Okay. Okay. Yes. Prepare. Prepare and be ready. Others learn from others. Prepare well. Take your time. Yes. Now, who is number one? Laraib Adil. Are you ready? Just those who are ready, type ready. Those who are ready can say ready. Type in the chat box ready. Yes. Laraib, okay, we are going to start. Okay, I will unmute you. Others, stay silent and listen. See the what are the suggestions I am giving you, also listen. Okay, how I am attacking. I may be a rude patient or an adamant patient or a reluctant patient. Okay, so Laraib, unmuted. Laraib Adil. Where is this? Unmute, yeah. Hello, Laraib.
Hello, sir. Good morning.
Good morning. So we are going to start, okay?
Okay, sir.
We are going to start now. 1 second. This is to Shahla Bashir. No, not Shahla Bashir. This girl's name. Nofa Hamid. Nofa Hamid. Then what is the other? Maimuna. Maimuna. Somebody message Ashwini to join the. Okay. Okay, I will message myself. Wait. Join the Zoom, please. Okay. Okay, ask Kezi also to join. Ask Kezi also to join. Please. Yeah. So let's wait a second until these people join. Let me see. Laraib, you have sent the letter for today. And I want you to do reading and listening also and send them to me without any corrections. Okay? If you send all these, I will move you into, what is that, OET? OET new group I have created and I'll move you there.
Okay, sir.
Okay, if you are regular, I'll move you there. That means you are going to submit me every day, one reading, one listening, one writing, and do speaking, one with me and two with Kezia.
Okay, sir.
If you, I don't want your okay, I don't want your yes, I don't want your no, I don't want anything. I just want you to submit all these things and then inform Ashwini that you have completed all these things. One reading, submit me. One listening, one submit me. One writing, submit me. Two speaking sessions with Kezia and one speaking session with me. That's it.
Okay.
All these things, if they are finished, then inform Ashwini, then she will add you into the group, or I will add you into the group.
Sure,
Okay.
sir.
And at the same time, send a message that you have completed all the 4 and you have to complete the report. I will show you how to write the report. Daily report,
Sure.
along with what is that? Timetable in the morning. Before sleeping, you have to submit your report.
So, okay,
So
sir.
what is the report? I'm going to show you now. So daily report, here it will be there. I'll show you. I'll give you the format also. And teach that girl, Rubina, she doesn't know how to prepare a report. So you can help it. See, this is the report. This is how report will be there. Okay. So there are many things, reports here. Daily report. So I'll show you that report, how you have to make. First, if you complete, then I'll show you those reports. Daily report.
Okay.
Daily report. Okay. Yeah. Yeah, see, these are the reports. We're going to submit like this report. I'll show you. So just write down what you have done, how you have done, and you can submit me there. That's it. At practice with, okay. At practice. Okay. So, you can take this. So, yeah, you can see here. This is called daily report. This is called daily report. Listening 34/42. Name Peter Simon. I'm sending you the format of daily report here to the Telegram channel. I want your daily report like this. So, what you speaking sessions you did? A, practice with Kezia. B, practice with Simon, like that. How many speaking sessions you have done? Here you are speaking 3 role play sessions or 2 role play sessions. Here name of your case notes, and here how many marks you got in listening and how you need not write. I will do that one. So reading and listening. So that is it. You have to practice. First you send me, then afterwards you correct and you can do it. Send me without correction. Your letter, listening, reading, and writing without any corrections you send me. Then afterwards you can correct yourself and submit your result like this. I'll show you this one. Fine. Right. Are you ready now?
Yes, sir.
Okay. No need to open your video. This is live now. Okay. No worries. Just practice well and do. If you cannot get energy here, then you cannot do in the exam. So get all the credits. Yes.
Okay.
Okay. Right. You can start.
Okay. Hello. Good morning. My
Good
name is
morning, nurse.
I'm working in this clinic as a registered nurse. How may I help you today?
Nurse, I am worried, nurse. I don't know what to do. Please help me, nurse. Please suggest me what is required.
Okay. So I have to come here for removal of stitches, mm, and for wound cleaning and redressing also. So do you have any concerns? So you can tell me, please.
Yes, nurse. I am worried about this condition. I don't know what is going to happen. Tell me present condition, nurse. Can you please explain me my present condition?
Yes, sure. Um, as you know, you recently you had surgery of squamous cell carcinoma. So do you know about this cancer? Uh, I want to tell you
Yes,
about
nurse.
this.
I don't know the seriousness of this condition, but can you please tell me, nurse? Please explain me more.
Yes, I will give you. I will explain you how what is the squamous cell carcinoma. Basically, this is the type of the skin cancer which can be
Yes,
caused
nurse, the
by.
doctor actually told me, doctor actually told me, but I did not understand what exactly it is. And at that time, I did not realize that it is, he told me some other name and I don't know exactly what it is. Yeah, he told me skin cancer, something. I'm a little worried, nurse, why it is upsetting me. Tell me, nurse, is that so serious?
Uh, yes, this is a squamous cell carcinoma, as doctor you told you. This is not very serious, and it can be caused by the direct exposure of sunlight and the ultraviolet radiation. So, but you already you had surgery, and I would like to reassure you, your surgery is fully effective. Your lesion has been already removed, so there is no any chances of cancer. There is no chances of cancer to be spread. So you don't need to be worried, and this is not a very serious condition. But you will just follow some instructions after your surgery, so they will prevent you from in future.
Okay,
Yes.
nurse. I think I have a better understanding of what squamous cell carcinoma is, and I want to know if I am likely to need more surgery to remove other lesions in the future.
Yes. Okay, sure. I will explain you now. You just follow some important things after surgery. You should monitor your skin every day. Like if you will notice any changes in your skin color or you will find any spot, you should immediately contact with your doctor. And also, there is no any required any surgery. As I told you before, your lesion is already fully removed, so there is no chances to be cancer, and there is no any further surgery is required in future. So
That's fine, nurse. And actually, the thing is, I always wear high factor sunscreen, 30 or higher. I wear a hat when I'm out in the sun, but I think it's too late now because the damage has already been done. I spent too much time in the sun in my teenage years, and I think that was what caused the problem. And there is no meaning in brooding over spilt milk. Past is past. How can I take care of it now, and how can I make it better? Can you help
yes,
me?
sure, I will. Yes, this is the most possible cause is because you are working since long time in direct sun, under the sun. So this can be caused of your cancer. But I want to tell you some important prevention. If you will follow them, you will be prevent from which will be prevent you from further in cancer or any skin diseases. Now, if you just cover your body when you are working in your sun, this one will prevent you from any further damage. Or you can use a hat because the direct they will protect you also your head of the from the direct sun. And you can use some sunscreen blocks and sunscreen sunblocks because this is also very helpful for your skin. Okay, do you understand what you should
Yes,
do while working under the sun?
yes, nurse. I definitely understand. And the thing is, I'll make sure I'll look after my skin from now on. I'll be bothered about it and I'll take all the precautions, all the suggestions you have given, I'll implement them right away. And I want to ask you, nurse.
Yes.
Um, yeah, my wound has been fine. And okay, what else I have to do for this one, nurse?
Okay. Can you please tell me, is there any you feel any pain or any discharge from your wound?
No, actually, it's fine. There's no pain. There is neither pain nor discharge, but I still think it's too early to have the stitches out.
No, Mr. Lincoln, this is not very early because normally we are removing the stitches after surgery within 7 to 14 days. So your time period is already near to finish, and your wound also healing, which is assessed by doctor. So now we can remove your stitches, and there is no any sign of infection or any discharge. So your wound is also become healed. This is the time of removal of stitches. Okay.
Okay. Yeah, that's fine, nurse. That's really fine. Yeah. And then, okay, I'm ready to have the stitches removed. Is there anything else that I need to know, nurse?
Yes, I would like to tell you some instructions which is we should be follow after removal of stitches, and also the consent form. I need your consent before removal of stitches. And the advice I want to do after removal of stitches, you keep your wound clean, dry, and covered because it will prevent your wound from any infection or any serious illness. So, are you okay? You can do sign now.
That's very nice, nurse. That's really nice of you. Thank you very much. Have a nice day.
Okay, thank you so much.
Yes. So, Larab Adi, are you
Yes,
ready to take some constructive criticism?
yes, sir.
Do you want me to say, yes, okay, you have done well, you have to improve, or do you want me to give some points where you can improve further?
Okay.
Do you want me to give some suggestions to improve further or no?
Yes, sir, of course. Please do.
That is what the response is. Okay means I cannot say which one, okay, first one or second one. That's what I will. Okay, so now I'm going to give you 5 points. 5 points. 3 mistakes only, plus 2
Okay.
suggestions. Okay. Three
Yes, sir.
mistakes. and 2 suggestions. Totally 5 points I'll give you. You said, if you will. Write down, this is a concept.
Yes, sir, I'm
If
right.
you will, you told. 2 3 times you have told, if you will. So here you don't know the concept, that if condition. So many people use the same, do the same mistake. This is a conceptual mistake. This is not just a grammar mistake. This is a conceptual mistake. You don't know. What is this concept? If you will come tomorrow, if you will come tomorrow, we can watch a movie. If you will come tomorrow, we will watch a movie. This is what you say. So that means there are 2 wills in your sentence. There are 2 wills in your sentence. Remember that. If you will come to the hospital, we can go to the movies. If you come to the hospital tomorrow, from after the duty, we can go to the movies. So if you will come, we will go. If you will help me, I will help you. If you will teach me, I will learn. If you will teach me, I will learn. So there are double wills in many people's sentences. This is an utter nonsense. This is wrong, literally wrong. Because if is a conditional. Conditional means things may have expected to happen or may expected to happen in the future or expected to have happened in the past, like that one. Not happened situation. So it will not have a modal. If you come, I will help you. So there will be only one will in any sentence, because that will determine the tense of the sentence. That is future tense. If you teach me, if you teach me, I will learn. If you teach me, I will learn. It's not if you will teach me, I will learn. No, if you teach me, I will learn. That means if will be gone away. You will submit the test. You will submit the timetable. I will correct your letter. You will submit the timetable. I will correct. Here both are correct. You will submit the timetable. Number 1, correct. I will correct your paper. Number 2, right. So if individual sentence, you can use will and will. But when you are joining with if, then you can say like this. If you will submit the timetable, I will correct the letter. This is one option. If you submit the letter, I will correct the paper. So this is second option. First option is wrong. Second option is right. If you will is wrong, because if is there, it's a conditional, so will be gone. So if you submit the letter, if you submit the timetable, I will correct your letter. That's it. So will with if is wrong. So there are 2 parts in the sentence. If you submit the letter is one part. I will correct your letter. So the clause without if will have a will. The clause with if will not have a will. Is that clear?
Yes, sir.
Okay, I cannot give you many corrections on a single day. I'll give you 3 corrections plus 2 suggestions. So this is called a conceptual mistake, which you are doing every time. Same mistake 3 times you are doing, so already 10 marks you lose. You already did 3 times or 2 times here. So you lost 10 marks there. Next one, you should be follow. You should be follow. What do you mean by you should be follow? You should follow. That's all. There is no question of be. In there, you should say will is not needed. That means you have a problem with future tenses. Okay, you have a problem with future tenses. If you will, you are saying that is problem. And you should be follow. You should follow. You can follow. There is no need of be. There is no need of be. In continuous tense, you can use be. You should be doing, you should be working, you should be playing. That means when ing is there, be will come. Otherwise, be will not come. This is a conceptual mistake. You should follow. Follow will not take a be. Follow will not take be. So it is a mistake. So don't use be in the future after should. You should be following. Okay. When it is V1, V1 means follow. Following is V4. Followed is V3. With V3 and V4, you can, okay, V with, you can use V with following, future continuous, and passive. It should be followed, passive. You can use. Otherwise, you cannot use. You should follow, you should work, you should cook, you should eat, you should sleep, you should, like that. Is that clear?
Yes, sir.
Number 3, no any kind. Why are you repeating these three times? First one also you repeated. Second one also you repeated. Third one, this no any kind also you repeated. You said 2 or 3 times. I don't exactly remember, but definitely 2, maybe 3, but definitely 2. Okay. You repeated these 3 types of mistakes you repeated. That means same mistake you are doing 3 times means you lose 10 marks. That means 3 things you are repeating 3 times means you lost 30 marks. Finished. No any kind. There is no any kind. What is this? There is no any kind. Why do you want to talk like this? There is no any kind. Okay. Instead of that one, you can say there are no problems. There are no problems. Remove there are no. It is a safe, harmless. Any word, another synonym you can use. No? No any kind. Why do you want to repeat the words? Don't use no any kind. It's a very habitual mistake you are doing. So don't use if you will. Don't you use you should be follow. Don't use no any kind again in your speaking sessions, because if you use these things, you are doing mistakes. So don't use these things. That's all. That means you will be correct. Now, what you should do? If you follow the suggestions, you will get good scores. If you follow the suggestions, if you follow my suggestions, you will get good score. If you submit the timetable, I'll correct your letter. If you are obedient, I'll support you a lot. So like this. Number 1, you should follow the suggestions. You should submit the timetable. You should do that speaking session every day. You should do at least 1 speaking session with Kezia. If you are going for the exam, you should do 2 speaking sessions with Kezia if it is near, with my permission. So this is the way. You should not correct your letters. I will correct your letters. You should not submit, you should not correct your reading. You should not correct your writing. Submit the listening and writing to me first. Then afterwards you correct and you can submit your scores. Because your correction and my correction will see the difference. You will get more marks, but I will not give you more marks. There are many mistakes, reasons why. So that's it. So if you are serious, I'm with you. If you're not serious, I'm not with you. That's all. Now tell me, are you serious?
Yes, sir.
Okay, next time. Pauses and breaks. 3 mistakes I have told you. Now 2 suggestions I am giving you. Pauses and breaks. What do you mean by pauses and breaks? Suddenly you are getting stuck and you don't know what to speak. So this is called these are called pauses. Means yesterday 2-3 seconds you are waiting like that, and I'm getting confused. What you're doing? What you're going to speak? I'm waiting for you. How long I should wait for you? That restlessness is in me when you're stopping for 3 or 4 seconds. So avoid that one. Pauses and breaks. Speak slowly, no problem, but avoid these pauses and breaks. Next one, unnecessary sounds. You're opening your mouth and saying then again closing your mouth because you don't know anything to say. Then again you are opening and saying, I am going, I am playing, or there is this is what I am telling you, these are my guidelines, something like that. First you're saying opening your mouth to say something, but you don't have anything, so you're stopping and closing your mouth. And again recalling, and then you're speaking again. So first time why sound is coming. If you want, you see the audio, it's there on the YouTube. That is number 2. So pauses and breaks, avoid unnecessary. This is called zero talking time. That means you are not talking, I'm also not talking. How come it happened? It should not happen. Next, unnecessary sounds, meaningless sounds. It's meaningless gibberish. There is no meaning. For example, if I say, Okay. Yeah. Aha. Oh. I have a meaning, but you don't have a meaning. If I say means okay. If I say aha means is that so? Yeah means I agree with you. For my every sound there is a meaning, but your there is no meaning. Do you agree or not?
Yes, sir.
Yes. Now I'm giving you 30 seconds time. I'm giving you 30 seconds time. Right. Come on, tell me. Give me your feedback. What did you learn? Were the suggestions useful? How was the session? Was it tough or good, or was the practice beneficial for you? Or you're getting scared or worried, or you can improve and you're gaining confidence on talking to me like this? You're gaining confidence. I know definitely. Otherwise, you'll
Yes,
never talk to me. Then how will you talk to the examiner? That suddenly first time you're seeing to a teacher only, you're not daring to talk. Then how will you talk there? Yeah, 30 seconds for you. Yes, your time starts now.
yes, sir. I learned how to talk in a confident way because when I taking practice and alone, I will do everything. What should I say? But in front of you, I missed many sentences. Even I write. Mm, And as you told me the suggestions, so it is very helpful for me. I will better for the next time, and also it will be helpful for my exam.
Yeah, did you submit your timetable today?
Yes, I submit already in the group.
Every day without my asking. Once I submit, you have to submit the timetable every day. Okay. I will not ask you. If you
Yes, sir.
submit the timetable, then you will be called like this in the same order, whatever it is. Okay.
Yes, sir.
You got it? And
Yes, sir.
speaking session will be happening like this with me. And writing session also automatically will happen with me. If you submit the timetable, if you don't submit the timetable, don't ask me. And I'm not answerable to everyone who just says, correct my letter now like that. Those who are following my rules and regulations, they will be done. Those who are not following my rules, I'm not going to help. Okay.
Okay, sir.
Yes. Thank you very much for your feedback.
Thank you, sir.
Next one. Next one. Who is the next one? Maimuna. Maimuna. Is there a Nofa? Maimuna, where is Maimuna? Maimuna, unmute Maimuna.
Hello, sir.
Yeah, no, Maimuna, I have sent you a card, okay?
Yes.
I have sent you a card, okay? So prepare that card and be ready. I'll take a session in between.
Okay.
Whatever I am giving you suggestions for nurses also, it is useful for you. Don't think that it is not useful because you're no daggers I am putting into the chest of anybody, right? Understand now?
Yes, understand.
These are daggers, okay, not ordinary things. If you have the courage to, if you listen to these people, nurses speaking, then you will know how to avoid your mistakes, okay?
Yes.
There is no difference for the nurses or doctors. So be ready, prepare and be ready. So when you are ready, just message me here in the in the chat box. I am ready, sir. Then I will give you the next speaking session because you are only one. I'll finish it off with you. Okay. Right. You can mute back. Next, second number. Who is the second number which I gave you? Sangeeta Patel. Hello, Sangeeta Patel. Sangeeta Patel. Hello, Sangeeta.
Good morning, sir.
Good morning, Sangeeta. Are you ready for the session or are you not ready?
Sir, not ready.
Not ready. Okay, get ready. Okay.
Okay, sir.
Next. Okay. Did you submit the timetable, Sangeeta? Sangeeta Patel, I did not finish with you yet. Did
Yes,
you
sir.
submit the timetable?
Yes, sir. I submitted.
Every day I want you to submit the timetable without fail. Otherwise, don't dare to talk to me. Please.
Okay, sir.
I love you. It doesn't mean that you can take advantage of me and do anything, whatever you want. Okay. I'm just telling everyone. So submit
Yes,
the
sir.
timetable and I'll call you. Otherwise,
Okay, sir.
don't call me, don't contact me, please. You're
Okay, sir.
submitting the timetable is your attendance.
Okay, sir.
Ashwini, every day make a list and add those who are submitting the timetable, them only we will be calling. You make the list and put it there. If anybody doesn't know the timetable, ask them to follow it. That's it. Yes. Next. Yeah. Next is Sajan Wavilla. Sajan Wavilla. Sajan is a regular student. Okay, Sajan, follow up whatever I have told you. Sajan, are you
Yes.
ready for a speaking session?
No, sir, it's my voice is too much of low.
Okay, no problem. What do you want to do now? Have you submitted the timetable first?
No, sir. I'll submit, sir.
You have to submit a timetable, otherwise you will not hear my voice. That's it.
Yeah, okay, sir. Okay,
To
sir.
go and do that one, then you will get the entry ticket. Without entry
Yes.
ticket, you cannot go enter the auditorium. It's a movie going on. Very high electrifying dynamic movie is going on here. Without entry
Yes.
ticket, you will not be permitted. Okay.
Okay, sir.
Ashwini will enter your name there every day. Otherwise, you cannot enter. That's it.
Okay, sir.
Okay. That's fine. Others will only just passive listeners. I don't mind. Next, who is ready? Maimuna is ready. Yeah. Others, anybody is ready, you can just type your name there. And only those who have submitted the timetable. Ashwini, yeah. Maimuna, have you submitted the timetable? I'll open your mic if you say you have submitted the timetable. Maimuna, I am ready. Have you submitted the timetable? Submitted timetable. I don't know. Have you submitted the timetable, Maimuna? Message there in the group. Submitted the timetable. Then only I will open the mic. Message there. I submitted the timetable. Yes, sir means I am ready, or submitted the timetable, or have you? I don't understand which question answer it is. Submitted timetable. Those who have submitted the timetable, message here. Submitted the timetable. That's it. Okay, Maimuna. Very good. Hello, Maimuna. Yeah, that is what I got. Please be, because I cannot check everything. Marina, Makoko, what is all these things? Full list you have typed there. Okay. Maimuna.
Yes, sir.
Dr. Maimuna, are you ready?
Yes, I'm ready.
Okay, fine. You have submitted the timetable, right?
Yes.
Very good. Awesome. You are a lovely child. Okay. You are a lovely child. Here, no? Many people are taking advantage of Peter, sir, because he loves students and he's taking everything. Okay. Means they are dancing their own wishes. Okay. Because if I am not serious, people are going astray. So I'm making them straight. I'm punishing them by making them strong. If I don't make strict things, then nobody will do anything. Yeah, Nasra Muhammad submitted the timetable. Very good. Kezia, are you there? Ashwini. Hello, Ashwini.
Yeah, yes, sir.
Have you informed Kezia?
Yeah, yes, she told me that she have a
Okay.
speaking
Message
session right
me.
now.
Message me. Just message me.
Okay.
Okay, the information should be passed on to me immediately, whatever. Okay, just message me there in the WhatsApp. Okay.
Okay, sure.
Next, Nasra, be ready. So second one is Maimuna. Maimuna.
Yes, sir. Should I start?
What is your second name, Maimuna?
Said.
Maimuna Saeed. Okay, Maimuna Saeed is the second one. Next, Nasra, be ready. Number 3. Nasra, second name Muhammad. Nasra Muhammad, be ready. See in the order. Be ready. Okay. Usha Binu. Yeah, I submitted the timetable. So 4, Usha Binu. Usha Binu. Yeah. Number 4, be order. In the same order, I'll be calling. Be ready. Prepare. I send the card in the group. Card number 5. So now let me take Dr. Maimuna. Yeah.
Yeah. So should I start, sir?
My mood, sir. There are some students who are disturbing my mood. Okay. I am public property. Okay. Don't damage public property. You will be in jail afterwards. Okay. I am public property. Don't destroy my mood. Okay. If my mood is destroyed, then I cannot do anything. All the people will be suffering. Don't say, sir, this, that, this. Don't disturb my mood. Be loving to me. Be affectionate to me. Be kind to me. Be generous to me. Because if you are coming with poisonous words or harmful words, or some negative words, I don't like negative atmosphere. Anybody talking negative things, I don't like. Please stay away from me if you are negative. If you are positive, here there is a full of electrifying impact. Those who are negative, please stay away from me. I don't want the negative people. Okay, just ask me and I'll give you whatever. So Dr. Maimuna. Dr. Maimuna. Speaking role play cards, doctors, medicine. Waiting. Speaking medicine. No. Official online poetry. Speaking doctors, speaking doctors. I'm cleaning all the dirty things, okay? I'm cleaning all the dirty things. I'm cleaning all the dirty things. There are disgusting things, sir. There are many disgusting things around. My kitchen is dirty now today. I did not clean it. My room is not clean. So some things, okay. For example, all we have to clean. In the same way, our platform has some trouble. I'm cleaning all that trouble. Okay. I'm cleaning all that trouble. Okay. So Ashwini, ask Neha. Neha Banu is going for the exam. Ask her to do the timetable and come here. Message her to submit the timetable and come for the speaking session. Yeah. Then next, who is that? What is this? Yeah. I will take it from here. So my speaking medicine. Speaking medicine. Okay. PDF. Speaking medicine. PDF. Speaking medicine. PDF 1. Speaking medicine. Speaking role play parts. Medicine. Or nursing. Oh, yeah. Yes. Yeah, this is the card for you. So this is your card. Edit. Don't open your video, only audio. So view full screen mode. Yeah, this is your card. Yeah. Maimuna,
Okay.
is your mic open?
Yes, sir, my mic is open.
Okay, you have already prepared, right?
Yes, yes.
Yeah, just give me a second. I'll take some water. In the meantime, you can prepare. I'm switching off the fan, so I don't want to disturb it. Yeah, 1 second. So, Ashwini, yes, take it out. All the regular students who are very sincere and obedient, those who are following you and whoever you remember, ask them to come and join with me, because today I'm take the attendance of all the students who are present, and I want the list of the students who are regular. Those who are attending this session, I want the list there on my WhatsApp. All the students who are attending this session, because this is very important. If they don't attend today's session, tomorrow they have to take our permission and then attend. Yeah. Yes, here we go, Dr. What's the name? Dr. Maimuna. Sorry, sometimes I forget the names. So, hide floating meeting controls. Yeah. Disable annotation of others. Hide meeting floating controls. Yes, doctors.
Yes.
Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. Today we are conducting the speaking sessions for all medical professionals. And today we have some doctors and nurses. And we have already completed one speaking session for Laraib Adil from Pakistan. Now we have a Dr. Maimuna. She's a doctor by profession and she's pursuing for OET, nursing, medicine specific OET. Yes. So, Dr. Maimuna, let me take my card here.
Okay.
Yeah. So, Larai Badil has sent the material. Yeah, fine. Good. Yes. So, okay. Okay. So, we'll go further. Medicine card. Medicine. Maimuna Said. Okay. Yes. Let me open the card here. Yeah. 45 years old, a mild heart attack. Yeah.
Okay. Hello, good morning. I am Dr. Maimuna, one of the treating doctor here. So may I confirm your name, please?
My name is Lincoln, Abraham Lincoln. You can call me Lincoln, doctor.
Thank you, Lincoln. Well, nice for coming here today. So, Lincoln, may I know that the concern that brought you here today?
Doctor, I have felt very much weaker and very tired since the heart attack. I'm worried, doctor, because of the physical activity. I do not know how much physical activity is sufficient. Is that walking or gardening or swimming? And if I strain much, I think it might bring on another heart attack. That is what is stopping me from any physical activity. Can you give me appropriate guidelines? What to do and what not to do, how much to do and how much not to do. Can you please help me, doctor? I'm a little bit puzzled about this.
Yes, sure, Lincoln. First of all, I'm sorry that I hear about your condition, but let me reassure you that you are improving. And this attack was 2 weeks back. And as you say that you are concerning about the next attack, but let me reassure you that this fatigue, it is normally present after this acute myocardial infarction. And you will have slowly you have to return to your daily life activities. And the important thing is you have to do the lifestyle modification. Like it is normal for you to have a gentle exercise, and you can build over it gradually. Is that clear for you?
Yeah, doctor, not quite clear, but I can understand almost everything. But I like to know how much of physical activity is advisable, to be more precise.
Yeah, so that is usually in the beginning, it will be started by like a very mild activity, whatever the level you can tolerate. But gradually, I will also suggest you to join the cardiac rehabilitation program, and they will also guide you. So you will do the exercise under the supervision. So initially, it will be a few like minutes, and which is easily tolerated by you, and gradually this will be increased in frequency and the duration.
Right, doctor, I appreciate your suggestions, but I'm an office worker and I sit at the desk all day, and there is no chance for me to move here and there. I just get dumped into the chair and I just do office work for files, clearing files and everything. I don't have even breathing time, leave alone having a cup of tea or some snacks in between. So tiresome, and you don't know, I don't get much physical exercise at work, doctor.
Yeah, I can see that you are having a difficulty with your job, but there are certain other things that can be done beside exercise, like lifestyle modification and healthy diet. So that will also be going to improve the overall, if you can use the healthy diet, that would be very useful. And second thing that you can just use you can move around, or when you're coming to the office, so you can come by foot and go by foot if possible for you, if the home is near. And that will also keep you physically active. What do you think about it?
Yeah, of course, what you say, that's fine. You mean walking for shorter distances would benefit or suffice? Yeah, definitely, I'll take your suggestions and I implement with all my heart and soul. But I'd like to know, yeah, I'm very worried about having another heart attack. I cannot risk that, doctor. So I'd like to know what I can do to minimize the risk of further attacks. I don't want to take any chances. I don't want to suffer again. So prevention is better than cure. So tell me, give me some, some measures how I can protect myself or safeguard myself from some other future attacks.
Yes, Lincoln, this is a very important question indeed. And I will suggest you that you have to keep the follow-up in the hospital and use your medication regularly. And as well as you can do certain exercises that will strengthen your heart. And you have to avoid the things which increase the cholesterol, and you can avoid the diet, as well as if any medication is prescribed, you have to regularly use them. And this, as I mentioned earlier, the healthy lifestyle, this all together will improve, and this will prevent and decrease lessen the chances of having the attack again in the future.
Right, doctor. That's very nice of you. It's very kind of you. And the information has been absolutely helpful. And I'll definitely try to gradually and systematically do more exercise. And I'll look into the other things. What's about this rehabilitation or something else, if you can suggest me?
Yes, yes. There is the program that I can link with you, is the cardiac rehabilitation program. As I mentioned, that there will be some exercise that will be done under supervision. And so I'm very happy that you agree with the plan of the care, and you you agree to adopt the healthy lifestyle and to do the exercises. So is there anything other concerning you, and do you want to discuss more with me?
That's fine. You have given me a lot. Your suggestions were quite helpful, and your guidance was absolutely fine. And your suggestion of rehabilitation program, I'll definitely look into it. And yeah, thank you very much, doctor.
Thank you. I will also give you some of the brochures and leaflets. So if you have any questions and if you have any queries about the cardiac health, it will describe you more. And we can arrange another meeting if you have any further worries to answer your question. Thank you.
That's very nice. That's very nice, doctor. Doctor, very nice. Thank you once again. Yeah. So Dr. Maimuna, I'm going to slaughter you or butcher you or cut you into pieces or slice you into cakes, whatever it is you think that is your problem. But I'm going to cut you. Do you want me to use a knife or a sword?
Sir, whatever is to improve myself.
Oh, so you need a stronger one, right? So you deserve a sword. You deserve a sword. Okay.
Okay.
Knife is not sufficient. You deserve a sword. That means both are okay. Knife means small cuts. Sword means direct cut only. 2 pieces. Okay.
Yes.
Correct or not? Okay,
Yes,
fine.
yes.
Yeah, we are in the war. We need swords. Knives will not help. Correct?
Correct.
Now you understand what I'm telling. Okay. Number 1, Maimuna Saeed from Pakistan, a doctor by profession. That's very nice. Yeah. First of all, you have used the word reassure. You have used the word reassure. Now, what is the word reassure? Are you using the word in its, to use the word? Do you want to use the word just to use the word? Or do you really want to reassure the patient? First of all, do you know what is the meaning of reassurance?
Really want to reassure.
So if you want to give reassurance, then don't use the word reassurance. Give reassurance. Now, what is this, sir, you are telling? How can we give reassurance without the word using the word reassurance? Actually, in fact, you do not know the actual meaning of the word reassurance. That is the point. It's okay not to know. It's okay not to know. But now, why I'm going here? Yes, here. It's okay not to know till now, but it's not okay. It's not okay not to know from now onwards. Yeah, I'm taking you to the father. That is Cambridge Dictionary. Cambridge Dictionary is the father of a student. That means the perfect teacher. Right. Now, here, reassurance. Now, what is this reassurance? First of all, you should know the power of this word. You are just using like that without knowing the value of this word. That's very clear. Many people do this. It's a pity that the emperor is coming in disguise and you are giving him ordinary treatment. It's a pity because you are not able to recognize the emperor itself, the king. Not only the king, he's the emperor. So reassurance is an emperor. So many people don't give importance. This is a C2 vocabulary. You want to give reassurance means remove the word reassurance and use this one. Give words of advice. Reassurance means words of advice. That means you want to reassure or you want to give reassurance means give reassurance. Remove the word reassurance and put this meaning. Give words of advice, give words of comfort, and these words and this advice should be intended to make someone feel less worried. You are using the word and you are not using it in the real sense. You are giving reassurance in words, not in deeds, not in real meaning. You're just using the word. You're not using its fullest power. If I give reassurance, how it will be now? Okay, I'll give you another chance, Dr. Maimuna.
Yes, sir.
I'm giving you another chance. Doctor, I feel that I'll get another heart attack. I don't want to get another heart attack, doctor. I don't want to risk my life, doctor, because I don't want to take chances. I have my family to look after. If I die, who will take care of my children? At least for them, I have to survive, doctor. I don't want I want to see my future of my children. I want to get them educated. I want to get them married. I want to see them happily living in the future, doctor. I don't want to die now. Please help me, doctor. I don't want to take the risk of chances. Now give reassurance.
Okay. I can see that you are so much worried, but let me tell you that the chances of having the heart attack are very less. And for this, I will give you certain advices like the lifestyle modification and the dietary advice to eat the healthy food and to do the and to comply to your medicines.
Finished?
So
Done?
yeah, exactly.
Done?
I can't.
No,
recognize-
done. Finished. I'm not saying anything. Finished. Your attempt
okay.
finished, right? Or still continuing?
Yes.
Yeah. Okay. Fine. Yeah. I'm not saying anything. I'm not saying anything. You're a student. Whatever you tried, you did. That's it. That's okay. That's okay. You did better. There is nothing called. There is nothing called bad. Everything is good. Earlier it was good. This time it is better, but definitely not the best. Do you agree?
Agree.
Yeah, that's what I'm saying. We are going to the right side of the balance. Right. Now let us see here. I'm giving reassurance. Now you are my patient. Come on, you tell me whatever you are telling, whatever I told, something like that, you tell me. I'm the doctor now. We are swapping the roles. Yes, start.
Okay.
Patient.
So doctor, I'm very much so doctor.
What is bothering you, Maimuna?
Yeah, doctor, I am very much worried. You know, I'm very much worried. I might get another attack, and I want to survive. I'm the only one responsible for my family, so I want to survive. I don't want another heart attack. I'm very much worried how much physical activity I can carry out, and for that I remain depressed nowadays.
Right, that's absolutely right. Your concerns are reasonable. The concerns expressed are reasonable. There is no doubt. Undoubtedly, undeniably, irrefutably, the concerns presented are extremely important. I absolutely agree with you. In this condition, there are a number of people who faced a heart attack, and after implementing the suggestions provided by the medical authorities, and showing absolute compliance with the medication regimen, dietary advice, dietary requirements, nutritious food, and then exercise activities. Majority have been successful in curtailing or minimizing or reducing the chances for the next attack, and leading a wonderful life without any complications, because prevention is better than cure. If we apply the same conditions in your case, if all these people are leading a successful and happy life and a normal life without any risk, then definitely you also can repeat the same and get similar results. If I were in your situation also, definitely I would also panic and be worried, because I am also a human being in the first place. How does that sound?
Yeah, this is like more of comfort and more satisfaction to the
I did
patient.
not use the word reassurance, but did I reassure the patient or not?
Yes, reassured.
With whose words he is satisfied? With your words or with my words? With your words he will smile, but with my words he will dance. Yes or no?
Yes, yes.
I
Agree.
mean, not real, in the heart. Okay. So that is the difference. That is the difference. And when you're speaking, the feelings should dance on your face. Okay. The feeling. Then only that means if the feeling is not there, that means you are not really speaking. You're just pretending to speak. Okay. Yeah, no need to worry. No need to worry. This is common. No need to worry. No need to worry. This is quite common. Can you see the difference, Maimuna?
Yes, sir. The tone of voice, I don't get it.
So first one doesn't give an impact. So when you're really expounding or, exploring chances of giving the real effect, that means you are living the situation, not pretending the situation. You are not enacting a role play, but you are a real doctor in a real situation, dealing with a real patient, and your real feelings you are venting out. That means you will get A grade. I don't know how you think. That's it. Now coming to the suggestions. These are for everyone. These are one sentence I'll give for everyone like this. Okay. These sentences are for everyone, not only for this Dr. Maimuna. Now the points I have written for you is Maimuna Said, reassurance. I reassure you. There is no strength in your word. There is no strength in your word. It will not make me happy. Not in words, but in deeds. You should say by emotion, you should say, use your feelings, you should say with love and affection and kindness and courtesy, with examples and putting your own into this field, that concern, you should express everything. That is called reassurance. Next, number 2. Too much. It's too much. It's beyond reason. Too many times you have used this one. I don't agree with this unnecessary sounds. Whether you're a doctor or a nurse, everyone does these things. Everyone. So avoid that one. This is, confusing. It is making me panic. I don't know what you're doing. Like that one. So avoid that. You listen to the audio afterwards if you want. The next one, confusion and chaos. One instance, there was confusion and chaos. What is that confusion? You told a half sentence and again stopped and again went back and started a new sentence. I don't know what you did there. You are out of your control then that time. You did not know what you are doing. Suddenly you started speaking something and you feel that it was not right. You went back and you started new thing. Why doing that thing which is not right? That means better prevention. No? Already did the damage because you have spoken already the sentence. Then you know that something is going wrong. Then you get back and you're coming again. So that is what it is. Try to prevent the damage. Instead of doing the damage and rectifying, try to prevent the damage. You are giving cure. But I want prevention. So better 1 second you wait. No. Why are you in a hurry to speak? I know. First time you are doing speaking session with me and I am looking like a tiger for you. Then what will you do there? There is a dynamite in the OET exam. He will blast you like anything. Then what you are going to do? Okay. Next one. Confusion and chaos. You said next, come by foot. Come by foot. Come by foot. On foot, not by foot. At least you have used foot. Many people say by walk. By walk is a wrong usage. There is nothing called by walk. You have to say on foot. I reached there on foot. I went there on foot. Traveling or covering short distances on foot is highly recommended. Traveling short distances such as office to home, it is 1 kilometer or 2 kilometers on a regular basis, or walking for half an hour for short distances, going to a grocery store, Okay, on foot is recommended, would be beneficial. Is that clear?
Yes, clear.
It's not by foot, and that by foot you have repeated. Normally mistakes we repeat, you don't know. Correct things we don't repeat. Mistakes, you said come by foot, go by foot. Repeated.
Oh,
Last 10 marks. Last 10 marks. If you do only one time, it will take another 2 mistakes and it will come. But repeated is a bigger mistake. So you lost 10 marks for this. You have proved that you don't know that. If you are told only once, that means by fluke some mistake happened. But second time you did, that means you are very confident that it is right. That means you don't know the concept itself. First thing is casual mistake. Repeating the same mistake is proves that you don't know the concept. It is on foot, not by foot. Is that clear now?
yes, clear.
Because you don't know that's right. That's very clear. I understood that you don't know that it is on foot. Right. Now, next one you said, as I mentioned that. I am happy that you agree. As I mentioned that. I am happy that you agree. Why all these things I, we, you are coming there? Minimize as far as possible.
Okay.
How you will use the same thing? I am happy that you agree. I am happy that you agree. How are you going? I will tell you now. I'll tell you how to change this sentence. Appreciate your acknowledgement. Appreciate your acknowledgement. Acknowledgement is appreciated. Acceptance is appreciated. Acceptance, or you can say, what do you say? Consent. Consent for something. Consent for removal of sutures is appreciated. That's all like that. So avoid I and you. If you cannot, you do like this. This is okay. This is okay. This is okay. But if you want to get better marks, you can do like that. Then next one. As I mentioned that, already mentioned, then why are you repeating? Already mentioned, then why are you repeating? Don't repeat, no? As I mentioned earlier, whatever you told earlier, you need not tell again. Tell in another way. If you say, as I mentioned earlier, means I mentioned earlier, that means you did not hear properly. Okay, that means don't use that sentence. Okay, don't use that sentence.
Okay.
So that's fine. Avoid personal pronouns. Avoid active voice as far as possible. Avoid repeating words as far as possible. Right? Now, I'm giving you 30 seconds. I'm giving you 30 seconds. Okay? Right. You have time to talk about your points. What did you learn? How was the session? Was it beneficial for you? Or I am correcting you too much? Or is it okay? Whatever you want to speak, your time starts now. Yeah. Is it muted?
Sir, should I tell? Okay. So
yes,
yeah, sir, it
give
is
me your
very
feedback.
useful.
What you felt in the session now, this session.
Okay. So it was very useful because I practiced first time and I was not aware to use the personal pronouns and the active voice here as well. I only thought that it was important in the letter, but now I realized that it is also important for speaking test. And I should avoid the word reassurance. And I was not aware that what mistake I was done, and then I recorrected it. And also I came to know my weak points. So which I will want to rectify.
Do you think that I'm a doctor? You are treating me like a small child. Are you feeling like that? Anything like that?
No.
Yes, you are a small child only for me. Okay. You're not a
Yes,
doctor
sir.
for me. You're a student for me. Okay.
Yeah, I'm student, sir. I respect you like a teacher.
Yeah, that's it. That's it. Because there are some doctors who feel, sir, yeah, I'm a doctor. I have so much experience. So what for me? Correct? No? Correct. So
Yeah, this is new for me.
I am like a father to you. I am I am your teacher. Remember that. I will be guiding you. Don't take anything. Whatever I tell you, it is for you. That's it. If I chop you only, yeah, if I chop you only, the test will be good in the future. In the exam, OET is a test. It's a dish. I'm going to prepare 4 dishes on you. Listening, reading, writing, speaking. How much I cut you, that much better your dish will be. You understand? Right. Next. Who is the next one? Who was the next one? That is Nasra. 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 Afterwards, Ushas Binu. Nasra. Nasra Muhammad.
Yes, sir. Good morning, sir.
Good morning, Nasra. All from Pakistan today in the morning. Morning attacking. Very good. Huh? Okay. Okay. Very good. Very good. I appreciate. I don't know. I have a good base in Pakistan. There are many students who are following me. I really love it. I really love it. Okay.
Yeah.
Right. So, you attended the sessions of, you attended the session of, 1 minute, let me switch on the fan and prepare my tea. Okay. You attended the session of Maimuna. Now tell me, you attended, no? Was it beneficial for you? Did you learn anything from there?
Yes, yes. Yes.
Okay, fine. So, very good. We are going to the session now. It is speaking role play 5. Yeah, here is the card. Are you ready or you need time?
Yeah, yes, I'm ready. I am prepared.
You are ready, but I am not ready. I'll go and get a cup of tea.
Ah,
Okay.
Okay, no problem. Okay.
So in the meantime, you get ready. 2 or 3 seconds. Think about it.
Okay.
Yes. Yes, and a big yes. Nasra Muhammad. Hello and welcome to 7 Sentinels. This is Grand Masterclass and I'm Peter Simon with you. Today we are conducting speaking sessions for the doctors and nurses. And yes, there is one more place for doctors, and for the nurses, all the places are filled. And this is the last batch for December, because next December Christmas is coming. So I'm not going to take any more students. All right. And those who are interested can book your places for January. So you can take the admissions in the January quota. You can ask me and you can book in advance, because now seats are totally filled and we don't have time to cater for others. Yeah. Right. So here we have a nursing card We have Nasra Muhammad from Pakistan. Yes, Nasra. You can start. Have you gone muted again? Okay, let me check. Nasra Muhammad. You got muted. Okay. Unmute.
Yes, sir.
Okay, don't mute again.
Yeah.
Next, Ushas Bino, be ready. Yeah, Nasra, you can start now.
So, hello, good morning. I am Nasra. I am the nurse who will be attending you today. How may I address you?
You can call me Lincoln, Abraham Lincoln.
So, Mr. Lincoln, can I know the reason of your visit today?
Actually, nurse, you see, I have come for this. I don't understand my situation. What have I to do and what should I not do in this situation? Can you please tell me, nurse?
Yes. So I believe that, as I see from your file now, you are here for stitch removal and redressing. Is that right?
Yes, nurse.
Yes. So, what do you have any concerns? Anything about it?
Yes, nurse. Actually, I have come here to know what I have to do. Can you explain the situation and tell me what I have to do now in this situation?
Yes, yes. So this what you had is one kind of skin cancer. This was caused by excessive exposure to the sun and harmful radiation caused by ultraviolet from the sun. And now that the lesion is removed, it's unlikely to spread it again or to come it back. So. But you need to be checking and to be watching your skin spots continuously. You have to you should maintain checkup, follow up, and you have by yourself. You need to be continuously checking your any changes in the skin spots and the colors or any unusual things that is there in your skin. And yes.
Yes,
And
nurse. Actually, the doctor has given me some name, I don't know, but from our discussion and what I can understand is something like skin cancer. What is that name? Some squamous, something he told me. I don't remember
yes.
exactly. But yeah, can you tell me more about this? I want to know everything. I don't want to take any chances. Can you please suggest everything?
This, as I said, it is like some kind of skin cancer. This is caused by sun exposure, and maybe in your lifetime when you were young, you used to be to go to the beach, and maybe you did not maintain the creams that protects from the sun rays, and this is. It's hard because the sun exposure does burns or the radiation that comes from the ultraviolet is harmful for the skin. So this kind of excessive exposure and the long-term exposure, it causes some kind of skin cancer. So this is one kind of it. And now since it is this lesion is removed from you, so it is unlikely again if it's to come back and cause again another spread. But you need to be checking continuously your future. In the future, you need to be continuously watching your spots and other spots if you have any discoloration, any lesions from in the future if you have. Then you need also to be regularly visiting to your doctor to maintain, there's no recurrence of this kind of skin cancer. And you don't need any further surgery or repetition of the surgery again. And okay.
Right. Actually, the thing is, nurse, now I have a better understanding of what squamous cell carcinoma is. Okay. So thank you for your thank you for the information which you have given.
Yeah. So may
Okay.
I ask you how you
I want to
usually?
ask you, I want to ask you if I
Yeah.
need more surgery to remove other lesions in the future.
No, you don't need now for this lesion. You don't need any more surgery, but you need to watch your skin. You need to watch to regularly check and visit your doctor, and any other lesion or any other spread of the disease, you have to maintain it and visit regularly to your doctor. And you don't need any further injury surgery. But I need to know if what you usually use to protect yourself from the sun exposure, or how you protect yourself usually when you are going outside, or maybe going for to the beach, or when you are exposing yourself to the sun for long time of periods. What you use, how you protect yourself.
Right. But I want to ask you one more thing. I want to tell you something. From my childhood, okay, I don't know how I was, but now I always wear a high factor sunscreen, 30 or bigger, higher. And I wear a hat when I am out in the sun. And but I think it's already too late because I have spent a lot of time in the sun when I was younger. And it's late and the damage has already been done. So especially in the teenage days. So no brooding over spilt milk and worrying about the past. What is it better for me to do now to avoid such complications in the future?
Yeah, because this is accumulation of those sun exposure for long time, long period of time. It caused that. But now you need to protect more. You need to wear your you have to maintain your prevention from the sun continuously. You have to wear your hat, as you say. You have to use your sun screen. Usually, you have to put it when you are going outside. That will protect you from any further damage to your skin. And now you are here for the dressing. I want to ask you if you have any severe pain or discharge from the wound, or any concerns about the wound.
Yeah, I'll make sure to look after my skin from now on. But the wound, I think it is fine. There's no pain, there's no discharge. But I still think it's too early to have the stitches out. What do you think, nurse? Is it not so early?
Yes. So now now we will need to remove the stitches, and then the doctor will see the wound and check it and see it, how it is healing. Is it progressing? It is healing normally, and normally this takes 7 to 14 days to remove the stitches usually, post operatively. And now you need to keep your wound dry and clean, and keep it after we remove the stitches. And that's all today, the procedure. And we will start, if you like, if you don't mind, we will start, and then after that I will call the doctor.
Yes, nurse.
Yes.
I understand what you are saying. It's definitely I am ready for the stitches to be removed. And let me know if there is anything else that I need to do.
No, just we need to open it, to prepare it, so that the doctor can inspect it, and after that we reapply, we remove the stitch and reapply dressing. We will start now.
Yes. So now, that's very nice. Thank you very much, nurse. I really appreciate your patience and kindness. Thank you once again. You can continue with the procedure. You can remove the stitches. Okay. Right. Now, let me give you the feedback. First one is, first of all, I'm really sorry to put you in an embarrassing situation. I told Nasra from Pakistan. Now, afterwards, when I started the speech, I remember, okay, you are from Sharjah, not from Pakistan. I'm really sorry for that because it went like a fluke. I did not even think anything. So, Nasra from Sharjah, United Arab Emirates. Yeah, sorry for that. Kindly excuse me for that mistake because it happened unknowingly. Okay.
Yeah.
Maybe you wanted to say, but you could not say. That's
No, no.
another. But
Okay.
afterwards, I realized, what did I do? But it was high time. We are already in the speaking session, so I did not want to disturb your flow. Okay, fine. The next one. When I was writing your name here, then I realized. Okay. First thing is, I want to give you vitamin tablets. Are you ready for that?
Vitamin? Yes, yes.
Something you are weak in strength, not in voice. Okay, you are very powerful voice you have. Okay, you are very. If you are standing in front of me and you are talking, then definitely my ear will blow and empty. It will become empty inside. That much powerful it is. That is different thing. But what I'm telling you is, you have some weakness.
Yes,
I
of
know
course.
what weakness it is, and if I tell you also, you will not understand. So leave that one. So to treat that one, I am your friend. You know, you can trust me. I'll give you some vitamin tablets. Will you take?
Yes, yes, of course.
Okay. Now I'm giving you the vitamin tablets. I'm giving you the prescription. Listen very carefully. Okay. And write down in your notebook and do it every day.
Okay.
Take a reading text, part C.
Yes.
And go on reading it loudly without any stop, as if somebody is doing a speaking session. How speaking, they speak in the speaking audios like that. You have to speak. Wherever full stop, there full stop. Wherever comma, there is pass. And see, now I am reading from the question paper, from the text. Confirm reason for visits, removal of stitches, food and wound cleaning, redressing, etc. Find out if patient has any concerns. Give information about squamous cell carcinoma, type of skin cancer caused by sun exposure, ultraviolet radiation, etc. Reassure patient about effectiveness of surgery, example, lesion removed, cancer unlikely to spread, etc. Stress importance of patient skin monitoring, example, checking for new changing spots, regular doctor checkups, etc. Resist request for information about further surgery, patient to speak with the doctor, etc. Find about patient's habits when inside. Like this, you should continuously read until the passage is completed. Is that clear?
Yes, sir.
Because
Yes.
you have a problem in fluency. I cannot tell you what is that problem, but you have a problem in fluency. Every day, take at least one speaking. If you want to get past OET, speaking, you have to do one part C reading, 6 or 7 paragraphs continuously like this. Is that okay?
Yes, sir. Yes.
If you want to get B plus, morning and afternoon. If you want to get A grade, do it morning, afternoon, and evening. That's it. Is that clear?
Yes.
Now
Just please, I understand that you want me to read, but see loudly.
Read loudly.
Yes.
Take a reading passage and read loudly as if Simon sir is reading. What you do is you open your WhatsApp. I should know that you are doing. I should know that you are doing. Take your WhatsApp, open your WhatsApp, start the recorder, press it and leave, and it goes on recording. And when you complete this one paragraph, send it to me. Then again, start another paragraph, complete it, send it. Third paragraph, another piece. The fourth paragraph, another piece. Fifth paragraph, another piece. Fatafat, it should go up. You understand now?
Yes, sir.
I should see your practice.
Okay.
Practice. Take an extract part C1 or part C2, only in part C. From first paragraph to the last paragraph, you have to read. No need to record continuously, but start one audio, go to the WhatsApp, then just start the audio and keep it running. You do it up and leave it. You go on recording and start reading one paragraph. One finished, send it to me. Then again start and again record reading. and send it to me. Like that, every day, morning, afternoon, evening, I want you to do this one.
Okay.
Is that clear?
Yes, sir.
Will you do that to me?
Yes, sir.
I need that proof here.
Okay.
You see the difference in speaking within 3 days. 3 days. High voltage vitamins, okay?
Okay, okay, sir.
Nothing is going from you if you are not doing, but if you are doing something, you are getting some benefit, okay?
Okay, sir.
Suggestions only. These are not orders. These are suggestions.
Yes,
Following
sir.
or not, it is your decision. Is that clear?
Yes, sir.
Then number 2, pauses and breaks. Pauses and breaks are there. So they're here, every time you're passing. That's your word. And unnecessary sounds you are making. And the way how you are speaking is also fine, very good. There is some sort of pronunciation problem. Arabic accent is coming in between. But okay, that's okay. Influence, mother tongue influence will be always there. Even for me also, it will be there. Definitely. Okay. So
Yeah.
that is okay, no problem. But as far as possible, try to practice. And what all suggestions I am giving? Okay, now I am giving you one sentence here. For everyone, I'll give one sentence. For everyone, I'll give one sentence. So I'm giving you also one sentence. Now the sentence is here. There is no brooding over spilt milk. Please let the past be forgotten. Don't say, please forget the past. Means you please forget. Let the past be forgotten. Delete it from your memory. Not, done cannot be undone under any circumstances. What is in the future is to be safeguarded. So instead of bothering about the past, prevent something which is going to happen in the future. Number of activities can be suggested. Follow up a regular monitoring of the skin cancer, skin lesions. Keep the wounds clean. Wounds should be kept clean. Skin lesions should be monitored. Skin lesions should be monitored. The wounds should be kept clean and dry. Regular dressing should be provided. Protecting the skin from dangerous conditions is suggested. The sun, going out in the sun for long time, longer durations, and heat conditions should be avoided. And regular exercises should be, dietary recommendations should be implemented. Medication compliance is advised. In case all these suggestions are implemented with all the heart, mind, and soul, definitely no looking back. The progress will be tremendous, and there will be a lot of difference in your. How does that sound? Is that clear?
Yes, sir. Yes, sir.
Okay.
Yeah.
So the way everyone I'll give a new sentence. So this sentence I gave for you doesn't mean not for others. Because for everyone I cannot give all the sentences. Now, Nasra Muhammad, you
Yes, sir.
have 30 seconds. Tell me about what you learned, how you felt the session. Was it beneficial or not? What do you feel about the session? What did you learn? How was the session with Mr. Peter? Practice with Peter. What it gave you? Come on, 30 seconds. Your time starts now.
Yes, sir. It is really good, really constructive, and it is providing us really to grow day by day. And now my weaknesses, I think, like you give me a reading to read loudly, and maybe I will be discovering myself what mistakes I'm doing, and I will improve maybe the speed of reading, because I have also I'm facing problem with the reading. I'm not that fast in reading, so that maybe I am hopefully now hopeful about reading. Maybe it will increase my
Yes.
speed. At the same time, it will correct my mistakes. So this will be beneficial in both ways.
Yeah, I'm going to give you one thing, okay? It will blow off your mind now. I think you have used the word kelima wahada, ishada, yani. Ma istakdam kelima yani.
Yeah, that means, in English.
Akbar mushkila.
Yeah,
Faham wala mafi faham.
yes, I understand. Yes,
Okay?
yes.
Okay, fine. Right. Now I'm telling you, don't use some other words which are related to another language because outright you lost 10 marks.
Okay.
You lost 10 marks if you use the word yani in your speech. Never use any other word from any other language. Okay?
Okay.
That's it. Okay, thank you for your feedback. That's fine. Now, who is the next in line? Who is the now next in line? Now I am ready for speaking, Sangeeta. But before you, I told somebody else, wait, Ushas Binu. Ushas Binu is 4. Then afterwards, Maimuna finished Sangeeta. Yeah, Sangeeta 5. Okay. Sangeeta 5. Sangeeta 5. Yeah, Sangeeta, I received your complete fees. Sangeeta. Sangeeta Patel. Sangeeta Patel. Sangeeta Patel. Yeah. So Sangeeta Patel is okay, fine. Now we are going to whom? Who is that? Ushas Binu. Ushas Binu. Others also. Those who have submitted the timetable, get back to me. Ushas Binu. Hello, Ushas.
Good morning, sir.
Good morning, dear. How are you?
Yes, fine, sir.
Very bad, no? Simon sir is attacking, right?
Really, I am little bit worried, too much afraid to talk with you.
Why? I'm so friendly. I'm so loving. I'm so affectionate. What am I doing? I'm an ordinary patient. I don't know anything. I just know English. I'm a patient, my dear.
I
I'm
can
not
understand,
English,
but I
sir.
am
I'm
too
a
much.
patient. I'm a patient. I'm in a role play. I'm a
I know,
role
but
player. I'm an interlocutor. I don't know English. I'm not Simon Peter. I'm not Grandmaster. Why should you be afraid of a patient? My goodness, this is too much. I'm only a patient.
I can
After your
understand.
only Simon sir comes into action. You're afraid of a patient? What nonsense are you talking? Huh? What you're talking? I'm a patient. I'm a patient, just a patient. You understand what I'm saying?
Yes, sir. Yes, sir.
When you are doing the role play, I'm not talking anything. Nah? Am I
Yes.
talking anything?
No,
Am I
no.
teaching grammar? Am I teaching speaking? Am I teaching anything? Am I doing? No, zero. Simon sir is zero there. Only the patient is hero there. You understand? Simon the
Yes.
patient. Simon
Okay.
the patient. You understand? Not
Okay.
Simon the patient. Lincoln the patient. You understand?
Yes, sir.
Peter the teacher is different. Lincoln the patient is with you. Don't worry. Don't you worry.
Okay, sir. I will do
Everything
my
is a problem with sir. Simon sir, we tell something, he will talk something, no?
best.
Right. Get ready for the attack, royal attack with all your swords and spears.
Okay, I will try.
I'm
My
asking
best.
only to try. I'm not asking you to master it now, right? Do whatever you can. That's all.
Yeah, okay.
Name is Ushas Binu. Ushas Binu. Yeah.
How can I introduce you during this role play?
Yeah. I am a Lincoln. That's what it is. Okay. Yeah.
Okay,
Hello
Lincoln.
and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we have speaking sessions for both the doctors and the nurses. And today we have the nurse Ushas Binu. Yes, Ushas Binu, your time starts now. You can go ahead.
Good morning.
Good morning, nurse.
Please have a seat.
Thank you very much, nurse.
Okay. I'm right to think your name is Mr. Lincoln. Is it right?
You are absolutely right, nurse.
Okay. And have come to removal of stitches. Is it right?
Yeah, the doctor told me that I had something called squam, something. I don't know what exactly it is, nurse. Can you tell me what is that?
Okay, don't worry, I can explain you. Then this now you came to visit the removal of stitches, and after removal that wound will be clean, and we will do the dressing. Okay, is it okay for you?
That is okay, nurse, but tell me what is this something I think like some cancer or something. What is it exactly? I'm little worried about my condition. First, clear me this doubt.
Okay, I can understand you. You are too much worried about your condition. Don't worry, you are in the right place. I will explain you. Okay, and
How can I not worry, nurse? I'm really in panic and tension. I don't know what is happening with me. And something cancer and I cannot worry. What you are
okay,
talking?
I will give you some information about the squamous cell carcinoma. Okay, it's a type of skin cancer usually caused by the sun exposure and ultraviolet radiation. Is it clear for you?
Of course, nurse, I can understand now what you're telling. Yeah, it's what I'm thinking. This is another name for what the doctor told. Yeah, I understand.
Yes.
I have a
Yes.
better understanding of what a squamous cell carcinoma is now. But I am asking you one question. I feel, is it likely, nurse, that I need more surgery in the future to remove other lesions?
No, this actually I will tell the firstly there can be effective surgeries are available. It means the lesion removal. Okay. One more thing I can remind you, it's a type of cancer, but unlikely to spread anywhere. Okay. Is it clear for you?
Yes, nurse. But tell me
And
more. I want to know everything about this.
okay, I can explain you everything what all things is. Next step, I can important you. The skin monitoring is the most important, such as checking for the new lesions. Once we remove the lesion, after that we need to check for the new lesions or any changing spots in your skin. And one more thing, I can remind you regular checkup by a doctor. That is important. Okay.
Yes, nurse. Okay.
Okay.
But I always wear a high factor sunscreen, 30 or higher. I wear a hat when I'm out in the sun. But yeah, of course, I think it's too late because, the damage has already been done. And I spent a lot of time in my younger days out in the sun and in my teenage years. I'm really sorry for that. But what should be done in the future to prevent such things, nurse? Can you please tell me?
Actually, this before you asked me about this regarding for the further surgery. Actually, now I can tell you. Unfortunately, I am not other person to explain for the further surgery. And you can speak with a doctor. He will explain you for the further surgery. Okay. And I would like to know about your habits. It means whenever you are going to outside, do you use any sunscreen or hat to protect in skin?
Yeah, I already told you, nurse, that I have wear a 5 screen sunscreen.
Okay, let me explain you. Ongoing the prevention of further damage and continuing to cover up when it the sun and to use some sunscreen. That is better to prevent the damage of skin, further damage. Is it clear for you?
Yes, nurse.
Okay. And do you have any pain or any discharge after surgery?
No, nurse, let me tell you, the wound appears to be very clean, no problem, I think. The wound has been fine and there is neither pain nor discharge, but still, I think it's too early to have the stitches out. I think, why not we keep some more time?
Okay, I can understand current situation. Now the doctor will come and check your wound area. Then he will assess you if any pain or if any discharge or any how is the wound healing. Okay. Then after that, usually that after 7 to 14 days, typically we are removed for the stitches. That is the normal way. Is it clear? Okay?
Yeah, of course, nurse. And
Then,
yeah. Tell me more, nurse.
okay, I can give you some advice. After can remove the stitches, the keep wound is clean, dry and cover it. Okay. That is better to avoid the further complication.
Okay, that's fine, nurse. Thank you very much.
This,
Thank you very much for the suggestions.
okay, so are you follow me?
Yes, nurse, of course. I'm able to understand what you are telling.
Okay. If you are agree to removal of stitches, can I take consent? Is it okay for you?
Yeah, nurse, I give my consent to remove the stitches because I understand what you're telling. There's some meaning and you know better than I.
Okay, thank you for cooperation. So meanwhile, I can prepare for the removal of stitches. So if you have any clarification or if you want any doubt, you can ask me. I can explain you what all things you want it. Is it okay for you?
Yes, nurse.
Thank you for listening.
Right, that's very nice. Thank you once again. Have a nice day, nurse. Thank you.
Okay, thank you.
Yeah. Okay, right. Pushes, Binu. You're crazy. You're speaking very nicely. Why are you afraid of me? I don't know. Mad you are.
Really,
Pushes.
your voice.
When you start speaking to me, that fear will go somewhere, okay?
Okay, sir.
Correct or not?
Yes, correct.
Were you afraid when you were speaking in me in the real situation? No, no.
No.
And then why are you afraid? I don't know. I'm a tiger or what? No. Okay.
Okay.
When you start speaking with me, automatically you will only see a patient because I will be totally like a patient only. I will not be like an English teacher because I am not going. I am a teacher. Different situation. I'm now taking a test means I'm a patient only. Correct? You understand what I'm saying?
Yes, sir. I can understand.
You are also not a student. You are a nurse. If you are a nurse, you will not fear. If you are a student, you will fear. You understand now?
Yes, yes, I can.
So if you are thinking like a student, that means you will fail.
Yes.
You understand what I'm telling?
Yes, yes.
If you are a nurse, you can pass. If you are a student, you will definitely fail. That's it.
Yes. Okay.
If you are a student, you will think grammar, vocabulary, pronunciation, vocabulary, that one sentence, this one, that one, you'll think. But if you are a nurse, you don't need to think anything, right?
Yes, sir.
That is what I'm telling you. When you see a patient, when I am talking like a patient, automatically, see, now I'm also looking at you not as a student. If I look at you a student, every sentence I will stop and say, this is wrong, this is wrong, this is wrong. You understand now?
Yes.
I'm a patient. No, there I'm only a patient. So you will not feel anything wrong because you're just seeing another patient and you're only a nurse and you are powerful. I'm not powerful actually. You are powerful. That you don't understand there before. But when you step into the water, you know how deep it is. It's very simple. Just you can drink. Is it clear?
Yes, clear, sir.
Next time, don't say I'm afraid. I'll throw you into hot water. Okay. I'll throw you into hot water. Okay, fine. Right, that's very good. You did a good performance. I think I was really shocked because when you said I'm scared in between somewhere you will stop. I thought, but no, you are courageous. You are doing fine because you started thinking like a patient, a nurse,
Yes.
and you are dealing with a patient. You are in a real situation like that, and that's all. Your real situation you are doing, not like acting, but you are performing. There is a lot of difference acting and performing. A person who is a student will start acting, but a real nurse will perform. You understand now?
Yes, sir, I can understand.
A real nurse will perform. If you are not a real nurse, then you will be doing acting. Is that clear?
Yes, clear.
You are not acting, you are performing. That's why words came and you spoke fluently.
Okay.
Real nurse knows everything. She has the command of everything because she has treated hundreds of patients, right?
Yes, yes.
Yeah. So first thing, I'm giving you 3 mistakes.
Okay, sir.
Afterwards, 2 suggestions, like everyone. First thing is you said, are you follow me? This is nonsense. Now Peter sir, the Simon sir is there. Now Tiger is come. Okay.
Okay.
You understand?
Okay. Yes.
Tiger comes alone, right? Tiger comes alone. Wolves come in packs. Wolves come in packs. That means there will be 10 dogs or 10 wolves, wolf family, dog family. Wolves, hyenas, foxes, jackals, dogs, these are all one family. You understand now?
Yes, sir.
Tigers, lions, leopards, cheetahs, these are all cat family. Cat family and dog family. There is no lion family, okay?
Mm.
We call it cat family. Big cats and small cats, big dogs and small dogs, that's all. So, now here, you are a tiger, remember that. Like Simon sir is a tiger, you want to attack Simon sir, you have to also be a tiger. And you are a real tiger or tigress, whatever it is. So, don't bother about anybody.
Okay.
Because tigers go alone and fight alone. You understand?
Yes, yes.
This fellow did like this, he did like this, he told like this, she told like this. None of your business. Correct?
Yes, okay.
Anybody is telling anything or not, that is not your problem. I am there with you. That's enough. More than
Okay.
enough, right?
Okay, sir.
So just listen to me, whatever I am telling you. I'll tell you
Okay.
only good for you because I don't have time to explain each and everything. So
Okay,
you
sir.
said, or you follow me. Or you follow me is wrong.
Okay.
It's a question. And you asked a wrong question.
Mhm.
Okay. And
Yeah.
you have grammar problem. Grammar is the glamour of language. You
Okay,
said,
sir.
or you follow me is wrong. It is no tense at all. It's not a tense at all. Such sentence doesn't exist. You have to say, do you follow me? Write down.
Okay,
Do you
okay.
follow me?
Mhm.
Question
Okay.
mark. This is called simple present tense.
Okay.
This is called simple present tense. This is called simple present tense. Okay.
Okay.
We'll do tenses one day because many people don't have fluency. One day we'll take fluency practice. Fluency practice. Ashwini, schedule one day fluency practice. If Ashwini is there, okay, she will mention. Otherwise, somebody message Ashwini. Sir told you to register for, because I'll forget. I will forget. Short-term memory. What to do? Because more important things are there, less important things will go off. Because student is more important. This point is different. So somebody write a message to Ashwini. Speaking tenses practice, live practice. We'll do everything together. Everything together. You'll speak with me so that you'll get fluency. Okay, this is this Ushas? We know. Yeah. Here it is. So here, are you agree? This is a nonsense.
Okay.
This is a nonsense. You have to say, do you agree? This is simple present tense.
Okay, okay.
You mute the phone now. Simple present tense. Because I'm telling, so I don't want any distraction. Second one is, are you? Sorry. What did you say? Are you following me? Are you agree? Are you follow me? Are you following me? Your sentence is, are you follow me? This is your sentence. Are you follow me is wrong. So you have to say, do you follow me? Do you follow me? This is simple present tense. Then you are saying, are you following me? Are with come with ing. It is present continuous tense. Present continuous tense. Present continuous tense. Are you following me? Are you following me? Present continuous. Use either simple present tense or use for present continuous tense. Okay. Don't use both. Don't use both. Yeah, Ashwini noted down. So, Ashwini, we can take when today is Monday. So, every day we can take 15 minutes for speaking practice. Yeah, 15 minutes. 15 minutes. What time will we fix? speaking, pronunciation, fluency, accuracy, everything. The session is called speaking, fluency, accuracy, pronunciation, practice. The topic for the session is speaking dash fluency, accuracy, and pronunciation practice. So this is the top title. Speaking, sorry, fluency, accuracy, pronunciation practice. So this is the title, and this session will be every day. When? What time is better? What time is better? Evening 6, no. 8, no. 10, no. 7:30. Yeah, 7:30 p.m. 7:30. That means 19:30 hours. 19:30 hours IST. Yeah. So keep it in a note for everyone. 7:30 will improve fluency, accuracy, pronunciation, practice. Tongue should go blah, 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 like that. Okay, that's it. So now, Pushas Binu, you can unmute again.
Yes, sir.
Yeah. So, second one is, are you follow me is wrong. Are you following me or do you follow me? You are putting the head of a lion. You are putting the head of the lion to the body of a fox. That's what you did now. No tense there.
Okay.
Follow is simple present tense. Are is continuous tense. Are you is continuous tense. Follow. So that is what you did. You took follow from here and you took are from here. So both together, which tense? No tense. This is no tense. This is nonsense. You understand now?
Yes, sir. Yes, sir.
When it is nonsense, I should say nonsense only, no? Correct. So make sense out of your speech. Unknowingly you're doing, nobody is a master. Everyone has different mistakes. Everyone has different mistakes. You have this mistake. Correct it. Finished. Correct or not?
Yes, sir.
I'm not destroying you. I'm constructing you. That's it. Constructive criticism, we call it. Next, second thing is, if you are agree, this also same mistake. This also same mistake. If you are agree. If you are agree. Same mistake. Can you see now?
Yes, yes.
R will go with ing. This is wrong. If you agree. Correct?
Yes, yes.
Or if you are agreeing. You understand now?
Yes, understand. Yes, yes. Understood, sir.
You are messing up with things.
Yeah.
Okay.
Yes, yes.
If you agree, finished. Huh? So the R is in continuous, agree is in simple. You are taking agree and putting to continuous. It's wrong.
Yes,
so two mistakes. So these are grammar mistakes. Okay.
Okay, sir.
So if you are agreeing, right. Next one. If you have any clarifications, what do you mean by if you have any clarifications? You are asking a nurse, you are asking a patient, if you have any clarifications. If you need any clarifications, you should say, you have clarifications. You need clarifications, you are giving clarifications, right?
Okay.
You are using a wrong word. How can you say, if you have any clarifications? He has doubts and you have clarifications.
Mhm.
If you have any doubts or if you need any clarifications.
Okay.
If you have any doubts, that is one.
Mhm.
Or if you want to use clarifications, you say if you need any clarifications or if you require any clarifications.
Okay.
Understand now? You
Yes,
said
yes.
what? If the third mistake is if you have any clarifications. If you have any clarifications. Okay, whatever. If
Okay.
you have any clarifications. So who has clarifications? Nurse has qualifications or doctors have clarifications. And patient only have doubts. So if you have any doubts or questions, you can say, correct?
Mm.
Or you can say, if you require any clarifications. You understand now?
Yes, sir. Yes, sir.
So you have messed up this word, right?
If you need.
You messed out. What you're talking, you don't know.
Yes, sir.
It is as if you want clarifications. Huh? So that's the mistake you have done there. You totally confused me. I did not understand what clarifications I have. I have only problems. What this nurse nonsense she is asking me. How can I have clarifications? I am only a patient. Am I a doctor to give clarifications to a nurse? This many questions are there in my mind. You understand?
Okay.
I am a patient. No, I am not Simon Peter, right? I am Lincoln the patient. Okay.
Mm.
And Lincoln the patient will get stupid doubts only. You got my point?
Yes, I got it.
So be careful.
Okay. Okay.
Is that clear?
Yes, I cleared, sir.
Yes. So don't panic. Attack. Attack.
Yeah. Mm.
Before the exams, I'll give you direct video classes. Now the only audio. Then you'll get stronger. Okay.
Okay, sir.
Then definitely, if you are taking audio classes, means you'll get B+. Okay.
Okay.
If you are taking video classes, you'll get A grade also. So that's it.
Okay.
Okay. Right.
Okay.
I'll give only I'll not give to everyone, only for those who are worthy, I'll give. Otherwise, I cannot give. No? Those are listening to me, following me. I least bother about anybody is paying the fees or not. That is not important for me. Paying the fees doesn't mean that anything. If you give time and you are to follow the rules and regulations and do everything, then I can give you everything, right?
Mm.
Yeah. So what you have to do is every day you have to submit your timetable. Today I
Okay.
want you all the 4 skills: reading, listening, right? Speaking I have done. With Kezia you do one. Then afterwards do one listening, do one reading, and send them to me. Afterwards correct and submit them. Before sleeping, I want your report, daily report, what you did, how you did. I'll send you.
Okay, sir. I can send it.
Yes. Okay, then now you have 30 seconds. You have 30 seconds. 30 seconds. Yeah, come on. Give your feedback, what you felt, how it was. In the beginning, you were afraid. Simon is a devil. What to do? Come on.
Exactly, sir. The beginning, I am too much afraid about how I can talk to you. Your voice also very, how I can explain. I don't know. I don't have any words to explain. That is the reason I am very afraid to speak it. Now
Okay.
I am realize everything is okay. I can, what all things I can do it. I can. Then I realize my mistake also. Actually, I was not know about this mistake. Whenever I am speaking, continue speaking, I am not clarify about this what all things is there or no. And no one also corrected. It was not corrected with me. So that is the reason I am continues the same type of words. And now I understood what I need to speak and how I can introduce the each card. Very helpful, sir. How I can't to tell anything more about this class.
Okay,
Too much
fine.
too much helpful.
Very good, very good. If anybody wants to come and study with them, tell them Simon sir is a devil, don't join with him. Okay. If you join, he will blast you, burn you, scald you, singe you. Correct, no? So better
No,
to avoid
sir.
cyber, sir. Right, no?
No, sir. No, sir. Whenever we have started to your voice, we are feeling all things same like what you told you. When they continue the class, then only we realized with whom we need to talk, how we can talk with you. Everything we realize.
Yeah. If you talk with a nurse, there are many nurses teaching, right? If you talk with a
Yes.
nurse, she will talk like a nurse only, correct?
Yes, yes.
Nurse is not an expert, no, language expert, right?
No.
So that is the
But-
problem.
Yeah.
Right, very good. Thank you for your feedback. And who is the next one? Sangeeta Patel. What is the time now? What's the time now? Who is this? 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 All right. Next one is Sangeeta Patel. Sangeeta Patel. Mona. Hello, Mona. New student. Hello, Mona. Unmute.
Hello, sir.
Hello, so Mona from Punjab,
Hello,
right?
sir.
Mona
From
or
Egypt.
Mona? This is Mona is another word. Sona, I think. Mona, tell me, Mona, where are you
I'm
from?
from Egypt.
Oh, Egypt, Masha Allah. What's that? Pyramids. Ana Irid pyramids.
Yes.
Wahad Yom Ana
Welcome in
Igi
Egypt.
Masar.
Anytime.
Wahad Yom Ana Igi Masar. You have to show me everything, okay?
You are welcome in Egypt, sir. You are welcome in Egypt.
Okay. And the min when? Shumail wala Janub?
La Shamal.
Shumail. Okay. Akbar Mushkil ala Simon sir.
Why?
Too much. See how he is telling too many rules, too many cuttings, too many suggestions, corrections.
Everywhere now. There is
Very good.
problem.
Welcome to the platform. Are you a doctor or a nurse?
I am a nurse.
Very good. Welcome.
Thank
Okay,
you.
where is
Thank
this?
you.
Sangeeta Patel. Sangeeta Patel, unmute. Sangeeta
Yes,
Patel.
sir.
Yeah.
Good afternoon, sir.
Good afternoon. Are you shivering?
Yes.
Why you are shivering? See, everyone is speaking nicely. You are also speaking nicely. Be a tiger, okay? Otherwise, I'll kill you. If you are like a lamb or a goat, I will kill you. Be a tiger.
Okay, sir.
We'll fight together for 5 minutes. That's all. Nothing else. You are a tiger. I am a tiger. Finished. Okay. Sangeeta Patel. Are you ready?
Yes, sir.
1, 2, 3, 4. Right. So you are ready. Let me take my card. Let me take my card. Ashwini, talk to Noha. Ashwini, talk to Nofa. There is only one more doctor there. Talk to Nofa and tell her to come and take the speaking session. Because otherwise she'll be missing. Nurses always will be there. But these people, they won't come. They think we are nurses, we are doctors, so we don't want to come like that, they think. So just tell them, okay, come here and finish the speaking. Nofa Hamid. She's there in the doctors group. Where is the card here? Yeah. Yes, 51 years age. Okay. Yeah, follow it up with Nofa. Okay. Yes. Control your background sounds. Hide
Sir,
floating controls.
that's not possible.
Okay, whatever it is, try to as far as possible. Right. Today's date is what? 12th. Okay, 12th December. Oh, 12th December. 12th December. Okay. Yeah. So we have only 12 more days. Christmas. Wow. Wonderful. Yeah, Sangeeta Patel.
Yes,
Are you
sir.
ready?
Yes, sir.
Yeah. Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. Today we are conducting speaking sessions for both the doctors and the nurse. And we are doing the role play here. The role play is a squamous cell carcinoma. And today we have the nurse, Sangeeta Patel from Gujarat. She's a nurse by profession and she's going for nursing specific OET. You can start now, Sangeeta.
Okay. Good afternoon.
Good afternoon, nurse.
My name is Sangeeta, one of the registered nurses working in this clinic. How may I help you today?
Nurse, I don't know what is going on. The doctor told something, some name, I don't understand, something Squamous or hummus or Squamous, I don't know what is that name, some Carci, okay, I don't know exactly. What is that, nurse? I think some cancer or something like that, but I don't know what it is. Am I correct, cancer, or is there something else? I'm a little worried. Can you clarify my doubt, nurse? I'm really upset.
Of course. So, before proceeding further, you are here to remove your stitches. Am I right?
Yes, nurse, you're absolutely right.
Okay. So I know this sound pretty worries, but don't worry. I am here to help you. So firstly, I will explain you in detail about what is this squamous cell carcinoma. Okay?
Yes, nurse, please, nurse, give me every bit of information about this because my life, it's totally depending on this.
All right. Squamous cell carcinoma is a one type of skin cancer, can grow largely and spread of body of squamous cell. And secondly, skin cancer occurs when coming excessive or overexposure to the sunlight and ultraviolet radiation. Is it clear?
Of course, nurse, go ahead.
Okay, uh, so uh, uh, it is caused by and sign and symptoms occurs that your skin become redness, fumes, and dull skin, and you are already lesson in your case a lesson removed already. You had already surgery done, and uh, I I'm sure it will help you to unlikely spread of cancer on other parts of the body. Okay.
Okay, nurse.
And next, you must important to monitoring your skin regularly and closely for the new or changing spots. And you must need to follow the doctor regularly. Is it clear?
Yes, nurse, of course, absolutely right.
Okay. So before proceeding further, do you want to ask any question regarding your condition?
Yeah, nurse, I have a better understanding of what squamous cell carcinoma is now. I really like, okay, I'm okay, clear, but I want to ask you, am I likely of having more surgery to remove the lesions, other lesions in the future?
All right, but I am not a authorized person to provide a more information about your further surgery. But but for this regarding, you have to speak with your doctor. I'm sure doctor will provide a appropriate information regarding your further surgery. Is it clear?
Yes, nurse, of course, absolutely clear.
So, could you tell me when are you going outside? Do you apply any sunscreen or hats?
Yes, nurse, I always wear a high factor sunscreen 30 or higher, and I wear a hat when I'm out in the sun. But I'm very sad, nurse, because I think it's already too late because the damage has already been done because I spent all my time in the sun, especially in my teenage years, and I I don't know what to do. But forget that. That's a past story. No more, action in the future like that. But what am I supposed to do in the future? Can you tell me?
Your concern is realized, but try not to worry. I will suggest you before going outside, you must cover up your body full for prevention of further damage. Okay.
Yes, nurse.
And may I know any pain or discharge after the surgery?
Yes, nurse. I will take care of my skin from now on and not risk my skin for the sunlight. And yeah, the wound has been fine, and there is neither pain nor discharge. But still, I think it's too early to have the stitches out. Why don't we wait for some more time, nurse?
Uh, all right. Typically, we are removed after 7 to 10 days after surgery, but after assessed by doctor, there your wound is very clear and there is no discharge or no pain. That's why you have to remove stitches. It is better for you. Okay.
Okay, nurse, I'll follow your suggestions definitely, and I give my consent for stitches removal.
Okay. So and next thing, after the remove stitch, you keep your wound clean and covered and dry. Okay.
Yes, nurse, thank you for all the suggestions. Thank you once again.
So if you agree, can I take your consent for
Yes,
the stitches
nurse,
removed?
I already gave you my consent. You are going to go ahead with removing these stitches.
Thank you.
Yeah,
So I hope I clear all the doubt or concern you have.
yeah, fine.
Okay. Is there
That's
anything
very
you
nice.
would
Thank
like
you
to
once
ask?
again.
Okay. Thank you.
Right. Yeah, coming to the point. Now let me give you some suggestions, Sangeeta. You are doing very well. You are talking like a small child, who is just learning words. Of course, that is right. Okay. Just newly learning words, how they are talking like that. You're talking very sweetly in small, small chunks. That's very fine. It's okay. Rather than speaking very fast and doing mistakes, you are slowly focusing on pieces, pieces, pieces. Very good. You are doing very fine. But what the suggestion I gave to that other girl, you also should do the same thing. Take a reading and go on reading, one in the morning, one in the afternoon, one in the evening. Definitely practice so that fluency you will improve. You have problem with fluency. So practice regularly so that the words will flow on in their own like that. Okay. Right?
Okay, sir.
Whatever you're
Okay.
speaking is okay, but fluency, very swear, not even fluency, it's going very low, lower than normal slow fluency. You're cutting the words here and there. Okay, so
Okay,
that's
sir.
what. So you have to improve your fluency. You have to practice, give tongue the practice to flow like that. So that's what is required. And you are speaking very nicely. Really, I appreciate you. You are actually afraid. That's why you said I'll do it in the last. But instead of last, you came immediately fifth place only. You came. That's really very good. I appreciate it. And
Thank you,
then
sir.
practice more sessions. And then, yeah, one sentence, a different sentence for different thing. Yeah. Reasons for removal of stitches. Yeah. Frankly speaking, the wound will be perfectly right within 1 to 2 weeks. Therefore, according to the normal procedure, the sutures will be removed after a week and before a fortnight. And the same patterns we are following for you also, because it is perfectly right. If necessary, or if there are any complications, then definitely we'll continue. But I don't think there is any requirement, because on examination, I have noticed perfect progress. Everything is fine. Everything is fine. So no need to worry. The wound is healing excellently well. It is already assessed by the doctor. And on doctor's recommendation only, I am removing it. So you can be free. Rest assured, feel free. Now, after the wound, keeping the wound dry, clean, covered is extremely necessary. Otherwise, there may be infections. If any complications arise, you can contact us. So, if you provide your if the consent is given, then I can go further with removal of stitches. Do I have your consent for the removal of sutures? Please. So this is the way I have given to the 5th point now. So everyone, I'm giving 1 point. So for Sangeeta, I have given the last point. Is that clear, Sangeeta?
Yes, sir.
And then you said squamous cell carcinoma is one type of cancer. A1? What do you mean by A1? Use A or use 1? Squamous cell carcinoma is a type of cancer, or squamous cell carcinoma is one type of cancer. Use A or 1. Why are you using both A and 1? Next, we are removed. No, we remove, or stitches are removed. What you are saying? We are removed. We remove, or stitches are removed. You are saying we are removed. So you're confusing active voice with passive voice. So be careful what you're talking. We are removed means who are removing you? From where are you removed? Why are you removed? What wrong did you do to be removed? You're literally confusing me. I don't understand what you're telling. We are removed? What do you mean by we are removed? Where is the message? What do you want to say and what you're telling? Stitches are removed. Okay, understood. We remove stitches, understood. But we are removed? I'm a patient. We are removed. Who is removed? From where? Why? What is the reason? I don't understand what nonsense you are talking. I don't understand. It's confusion for me. Be careful. Is that clear?
Yes, sir.
Okay, that's it. And you have to work on your fluency. Now coming to the point, you have 30 seconds to speak your voice. Say whatever you learned, however you felt. How is the session with Simon? Everything. Your time starts now.
Firstly, I would like to tell you, sir, your motivational speech is a very impact on my improvement. I feel that I little bit improve. My fear is a little bit reduced. So nice to talk with you, sir.
Okay. What is the name of your rubber band? I mean your husband.
Hiren.
Hiren Patel. Huh?
Yes, sir.
Tell Hiren Patel you only talk with me in English from today. Simon sir told me. It's an order.
Okay, sir.
If you don't talk with me, I will not give you food every day. Tell him.
Okay, sir.
Okay, whoever, even if you are talking to your baby, how old is he or she?
Now it's just 2 years, sir.
2 years. Even if you are talking to your baby, you talk only in English.
Okay, sir.
English is your medicine now.
Okay, sir.
Talk in English, eat in English, walk in English, even sleep in English only. Nothing, anything. No, you forget your Gujarati for these 2-3 months. You understand? Hello? Hello? Sangeeta Patel, muted. Okay, Sangeeta, unmute. Hello, Sangeeta.
Yes, sir. I'm
Why
here.
you muted? Okay. You understand what I'm saying?
Yes, sir.
Tell them, if you don't speak with me in English, I will not give you food. Finished.
Okay, sir.
Tell my name. He knows
Okay.
me, no? How Kadus I am, correct?
No, yes, sir.
Okay. So from today onwards, only English for you.
Okay,
Every
sir.
day. I told that girl one speaking, but for you two speaking, two part C, both you do in the morning, another part B, A and B, part C, first and second, both in the afternoon, both in the evening, because you need more.
Okay, sir.
You understand?
Definitely. Yes, sir.
Because your disease is more, no?
Yes, sir.
You need double dose, understood?
Yes, sir.
For ordinary disease, only one bottle saline. IV, intravenous saline. For you, I am giving two bottles intravenous saline morning, 2 bottles intravenous saline afternoon, 2 bottles intravenous saline evening. You understand now?
Yes, sir. I understand.
Then you have to send me in audio every day.
Okay, sir. Definitely.
Every paragraph you have to take and send me.
Okay,
Otherwise,
sir.
don't come tomorrow.
Okay, sir. Thank you, sir.
Okay, then bye.
Bye.
You can mute back. What is the time now? 1:54. Yeah, we have half an hour more because lunch break. I did not have my breakfast, Mr. Lunch will have grand lunch. Okay. Manjeet. Hello, Manjeet. Manjeet Singh, Manjeet Kaura. Manjeet Singh or Manjeet Kaur, unmute please. Hello, welcome to the platform, Manjeet. Okay, if you are okay, comfortable, you can unmute and say about yourself. I am so and so, I am so and so, doctor or nurse or whatever you want to say. You can say, otherwise, no problem. You can be muted only. Yeah, Manjeet, welcome. Yeah.
Yes, sir.
Yes, Manjeet.
Yes, sir.
Manjeet Singh, huh?
Yeah, Manjeet Singh, sir.
Yeah, welcome. How are our sessions?
My session is very well, sir. But some things are very, very benefit for me. I'm a pharmacist, sir.
You are a pharmacist. Okay, okay. Ashwini, fix his timing for pharmacy. One speaking we can take for him. Okay, in any one of the groups where Ashwini is there, just raise your hand and say, Ashwini ma'am, please fix one session for me. I'm giving you permission. One session. Okay, she will fix one session for you.
Okay, sir.
Right, right, very good. Next, who is the next speaking candidate? We can do 2 or 3 more. Anybody who has submitted the timetable only? Anyone who has submitted the timetable? Ashwini, put your phone number here. He will contact you. WhatsApp. Send your WhatsApp number here, so that he will contact you. Fix his time. One speaking session for pharmacist. And there is one Mahin also. Mahin. I told her I'll give, but I forgot. Mahin, you know Mahin, I think. She's in Pakistan group. So you can invite her also. She's also pharmacist. And add this boy, Manjeet, in pharmacist group. Right. Add him in pharmacist group. You are the member there in the pharmacist group. Yeah. So next, who else? Check Ashwini, who have given the timetable. Yeah. Sangeeta over. Trecia is there. Trecia is there here. Trecia is not there. Shifali, submitted timetable. Shifali, are you ready for a speaking session, Shifali? Where is Shifali? Shifali or Shifali? Unmute Shifali. Shifali is on
Hello,
duty.
sir.
Yeah?
Hello, good afternoon, sir.
Good afternoon, Shifali. How are you?
I'm fine, sir.
What is this, Simon sir? I don't understand anything with this, Simon sir. Correct, no?
Little bit trying to understanding you.
Every day he
Do
will
you
do
understand?
something. Every day he will do something. Just to be behind Simon sir. He will take care of everything. He will show you the world. Okay. Yeah, tell me. Are you ready for a speaking session to be blown, blasted, and fired?
Sir, I'm little bit confused. I'm ready or not.
Okay, take some time. Take some time. No problem. Prepare. No, I'm giving you time. Na? Okay. Prepare and be ready. Okay.
Okay, sir.
Next. Sergeant, have you submitted the timetable? Sergeant. Unmute. Sergeant.
Yes, sir, submitted, but I'm not well, sir.
You're not well. Okay, fine. No problem. Take your own time. Next one, there is a Raja Lakshmi, Rakhil Barkat, and Kasturi Katuri. Blesses Siromani. Okay. Meera. Okay. Anybody is there here? Ashwini, check, please. Ashwini, check. Why don't you call them and tell them to come and do speaking in the group? I'm taking speaking. Call them in the order. Sangeeta is over. Write down Sangeeta speaking finished. Then Ushas Binu speaking finished. Then Laraib speaking finished. Whoever finished. Nasra Muhammad finished. Yeah. Others, they can go and do reading and listening. And those who want to do speaking, stay here. Nofa is there or not? Maranang Makoko. Hello, Maranang. Hello, Maranang. Unmute. Hello, Maranang. Rubina. Hello, Rubina. Rubina. Did you submit your? Yeah, Maranang, you cannot unmute. Do something to unmute. Otherwise, how can you do speaking session? How can you do speaking session otherwise? Huh? You have to do something. You have to do something. You have to do something. Huh? Okay. If you unmute, your mic is going off. So do something. I want to take speaking session for you. Are you ready? Are you ready? No problem. I have option to you. Rubina is on duty. Okay. Rubina is on duty. Anvi Jacob, do you want to do speaking? Anvi Jacob, do you want to do speaking? Aparna, do you want to do speaking? Aparna, do you want to do speaking? Okay, I'll call you on WhatsApp. No doubt, Maranang. I can take speaking on WhatsApp. Don't worry. Okay. Aparna, are you interested to do speaking? Aparna, are you interested? Anvi Jacob. Come on, message something, na? Message something, na? Hi, sir. After some time, I will call you. Okay, sir. Okay, sir. No problem, sir. Huh. Yeah. Maranang, is that for your friend? I think you have sent some money. I think I don't know who sent, but I think you only. 2 friends you told. So that admissions are closed. Only those 2 people I have kept a message me there personally. Okay, I'm speaking you. I'm calling you. I'm calling you for speaking session from another number. Maranang Makoko. Maranang Makoko. Where is he? Maranang. Okay. There is Maranang. Such participants. Maranang. M-A-R-E. No. Maranang, yeah. Maranang messaging WhatsApp message, yeah. Yes. Maranang, pick up your phone. Hello, Maranang. Hello, Maranang. Yeah, Maranang.
Hello, sir.
Hello, how are you? Are you ready for the speaking session? Are you ready for the speaking session?
Yes, sir, I'm ready.
Okay, then we can start. Did you submit your timetable today?
Yes, sir, I'm already submitted.
And every day I want that one, okay, without fail.
Okay, sir.
So speaker is here, okay. Yeah. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Today we are conducting speaking sessions for the medical professionals, mainly for the doctors and the nurses. Today we have here with us Maranang Makoko from Lesotho, Africa, from Maseru. Yeah, Maranang. Your time starts now.
Yes,
You
sir.
can start. You can start now.
Okay, sir, thank you. Good afternoon.
Good afternoon, nurse.
My name is Maranam Makuka and I'm one of the registered nurses on duty today in our facility. So how may I address you?
You can call me Lincoln, by the way. My name is Abraham Lincoln.
Thank you. So, Mr. Lincoln, I can see from the case notes that you are here for suture removal and wound dressing. Is that okay?
Yes, nurse, of course. But I want to ask you one thing before, because I'm worried, I'm too much stressed and upset. I don't know what this doctor has told. He told some peculiar name, something cell carci, squamous or something. I don't know exactly. Can you please explain me? I think is it something dangerous like cancer or something like asthma or what it is exactly? I don't know. Can you give me a clearer picture?
Thank you. 4 types of skin cancers, and yours is squamous cell carcinoma, which can be noticed on the center. Is that okay?
Yes, nurse, of course, absolutely okay. Can you explain me further?
So if the lesion is there, the best treatment is surgery, whereby you go to theater and the lesion and that treatment is highly effective, as the chances for cancer recurrence is minimal. Is that okay?
That's absolutely fine, nurse. What you have given, I have a better understanding of what squamous cell carcinoma is now. And I want to ask you if I'm likely to need more surgery to remove other lesions in the future.
Thank you, Lincoln. If the eruptions are there on your skin, you have to seek medical attention so that the doctor can confirm that you have to go for surgery. But if we keep on putting the sunscreen and wearing long sleeved t-shirts when you go out of the house, it will be of benefit. Is that okay?
Yes, nurse.
Thank you. So is there any other concern up to now?
Yeah, I don't have any concerns, but I'd like to know more things about this one. What is the reason why it is happening and all these things? Okay, I have understood very clearly, but what else can I do for this, nurse?
So this problem of the cancers comes after you've been exposed to the sun for long hours. But if there is preventive measures that you can do, that one of applying the sunscreen when you're going outside the house and the wearing of a long sleeved t-shirt and putting on a sun hat in order to protect the skin from the sun rays. Is that okay?
Yeah, that's absolutely fine, nurse. And actually, the thing is, I always wear a high factor sunscreen, 30 or higher, and I wear a hat when I'm out in the sun. But the damage is already done. I think it's for it is late already, and because this is the mainly because when I was a child and in my teenage days, I spent a lot of time in the sun. Maybe that's the reason.
Okay, so you are doing a good job by putting the sunscreen and wearing a long sleeve t-shirt, so you have to continue doing that. But if the eruptions can occur,
Yes,
you have to
nurse.
seek medical attention on time so that the doctor to spread to the other body parts. Is that okay?
Yeah, that's absolutely fine, nurse. That's absolutely fine. Thank you very much. But yeah, now I will look after the skin from now on because yeah, it's more important for me. And what about this? Yeah, fine. Yes, nurse. So there was an interruption, and we tried to yeah, regain the connection, but will not get it. So we'll move forward. If she calls us, we can continue. Otherwise, yeah. Maranang, you're doing well. You have a strong vocabulary. Your vocabulary is absolutely wonderful. I really appreciate your vocabulary because you have proved that you have a strong, you have a lot of strength in vocabulary, and pronunciation also is very good to a larger extent because I think because you're working in the United Kingdom for quite some time and you're really serious, you're dedicated, and I know the way how you have passed down the information to others. So because you are really, that is impacting you. You did not not only realize that the quality which we are giving is very good, but you have passed down the information to others and you're forcing your friends to come and join. That shows that how much serious you are, and not only you, but you're influencing others also. I really appreciate you. But the thing is, what you're doing is not sufficient. Let me tell you, first and foremost, the problem with you is you have to get a Wi-Fi connection, high-level Wi-Fi connection, just for 2 months. High-level Wi-Fi connection just for 2 months. Whoever doesn't have Wi-Fi connection, strong one, please take them for 2 months. Please. Otherwise, this is the problem we'll face. So that's the point. And then, yeah, your pronunciation is quite good. Your style is also good. You're very confident. You don't panic, and you are presenting everything perfectly well. And then the way how you're speaking, which shows that you're already dealing with the patient within English. So that's the reason why you are at home with your language. At home with your language is perfectly perfectly at ease. No difficulty. That's what, without any difficulty, you're managing things. That is called at home. At home means comfortable. At home is an idiom meaning comfortable. It's the meaning. So you're at home with language and presentation when you are doing. Okay, fine. That's really very good. I want more sessions from you. So do some Wi-Fi network. Otherwise, this is the problem. And try to take some other phone which will not trouble you like this, because directly in the Zoom only you can do everything. That's absolutely fine. That's wonderful. That's really very great. And I really appreciate your dedication, because every day without fail you're submitting the timetable, and without fail, even before I ask, you're trying to do those things. And that's it. That's it. You are interested only for writing in the beginning. You registered only writing. Then afterwards, you registered for all the courses, reading, listening, and speaking also. Really, I appreciate you. Thank you very much for being my student. Make me proud by getting the results also. And my only one suggestion for you is get the Wi-Fi connection. Where you are weak, there make strong. Not only in subject, in other areas also. Okay, make yourself strong. Get a strong Wi-Fi connection. And if possible, take an alternate phone so that you can attend the Zoom session. No problem. Take another phone where this problem will not be there. That's it. So that is all for Maranang Makoko from Maseru, Lesotho, Africa. That's really very nice. I have a great number of following from Lesotho and Nigeria, and now in Pakistan. Right, very good. That's wonderful. Really, you put extra burden on my shoulders because of your trust in me. Okay, so thank you for your trust, and pray that I live up to the trust and follow it up with me so that I can go with you. Right. So next one, who is the next? Who is the next? Who is the next? Maranang Makoko. Okay, fine. Who is the next? Who is the next? Who is the next? Who is the next? Ashwini, follow it up, please. Follow it up. So next we have Anvi Jacob. She said after some time. What is this? Yeah. Shifwali card is not visible. What is this? Next, Vincimol Thomas. She's busy. Sarjan afterwards. Meera. Rajya Lakshmi. Rakhil. Kasturi. So these people, they can be called here. They can be called here, and we can go ahead. Is there anybody who is ready to do speaking session? Vincimol Thomas, do you have 5 minutes? Do you have just 5 minutes, Vincimol Thomas? Can you give me 5 minutes? Can you give me 5 minutes? I know you are very strong. You can do this one. Even preparation is not needed for you. Okay. So if you are interested, you can raise your hand and you can finish the speaking. Otherwise, just a message in the group. Okay. If it is not possible. Aparna, are you ready for the speaking session? And we Jacob. Right. Ashwini, follow up, because I'm out of WhatsApp. I don't know what is going on there. Please follow it up. I told you yesterday itself, you have to take care of everything there, because I'm out of, because you are there only, I'm here. Okay. Right. Okay, now it is 2:16. We have still 15 minutes. Anybody, one person, any one person, any one person, any one person. Rakil is available. Where is Rakil? Come on, Rakil. Rakil, where are you? Where are you, Rakil? Come fast. Thank you, Ashwini. Thank you, Ashwini. You are doing a good job. Get Rakil here. Bind her with ropes and throw her into the group here. Come on, fast. See, from morning we are here. Neha doesn't come to the speaking session. Then after she'll come, sir, she'll raise her hand. What to do with the people, I don't understand. Rakil, come on. Yeah, very good. Welcome, Rakil. Come on, Rakil. Hello, Rakil. Hello, Rakil.
Yes, sir. Hello, sir. Good afternoon.
Hello, Rakil. From morning, I'm on the platform. Where are you? Come and finish your speaking session every day. Okay?
Okay, sir.
Yeah. So your exam is fast approaching. I'll take 2 speaking sessions, one now and one in the afternoon. Okay? Okay. Now, did you prepare or not possible? It's okay. Binsi, it's okay. No problem at all. No problem. Just asking you. Yeah, Rakil, this is the card. Have you already prepared or do you want to prepare? Tell me. Rakil Barkat. Where is Rakil Barkat? Again went out. What happened? Oh my God. Did I say anything wrong to her? Network problem or something? Yes, she has come again. Oh, Rakil, I thought did I say anything wrong to you? Oh my God, you scared me.
No, sir. Actually, my headphones
You
are
came
not
and I
working.
told
That's why.
sentences and you went out. I thought, did I say anything wrong or you offended or what happened to you? I was thinking, especially with
No,
girls,
no, sir.
especially with girl students, we have to be very careful when they get offended, when they cry, when they get upset. Don't know. Anything can happen with
No,
girls.
sir. I'm not that kind of girl. Don't worry.
No. You are of a different metal, huh? Okay, okay. Then very good, very good. I like you. Yeah. So because I'm very careful with girls, okay.
Okay, sir.
Extra unnecessary sensitive.
Sir,
Yeah, get ready.
yes, sir. I cannot see the card properly. Did you send
Card
in the
is
group?
there. Card is there in front of you.
Okay, okay.
You prepare 3 minutes.
Okay.
Mommy, what is this mommy doing there?
Sir, my daughter, she's watching cartoons.
Okay, okay. I'm just joking. I'm just joking. Indirectly, I'm telling you to give her responsibility to somebody else and you follow it up. Marina, number 7. Number 7 is Rakhil Barkat.
Yes, sir. We can start now.
1 second, 1 second, 1 second. Ashwini, prepare the next one. Yeah. So we are starting the session. Ready? Be ready. Hello and welcome to 7 Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting speaking sessions for the medical professionals, especially doctors and nurses. Today we have here Rakhil Barkat from Pakistan. Yes, sir. Rakhil, you can start now.
Hello, sir. Sir, may I know that what I call the patient? Like,
yeah, my name
what
is
is
Lincoln.
the name of the
Abraham
patient?
Lincoln is my name.
Okay, okay, sir. Hello, Mr. Lincoln. Are you Mr. Lincoln? Is that right?
Yeah, of course. I am Lincoln. Thank you very much, nurse.
Yes, Mr. Lincoln. May I know the reason that why you are here in the hospital?
Yeah, I came, whatever reason, these stitches or something, whatever reason I came, that is, keep it aside. Nurse, first tell me one thing. This doctor told me something like Squamous cell Carcinoma or something. I don't know what exactly it is. I feel that it is something like a dangerous disease, like a cancer or some virus or something. I don't know, dangerous virus, I think. I don't know what exactly. Can you give me a clear picture about what it is? Can you? I want it, nurse. Please.
Yes, yes, sure, sure. I will explain you everything in the details. And first of all, I have to explain to you regarding your disease. You have a squamous cells carcinoma, which is another type of the carcinoma of the skin disease. And you have a wound over there, and there is a stitches removal today. And as I checked your discharge summary, today is the date of your stitches removal, and we will remove and doctor will remove your stitches, and also he will observe your wound. Is that there is any not any discharge or oozing or whatever the skin condition is, either your skin is in the healing process or not. So he will explain you more better in the details. Okay. And So may I know that how you have this disease? Like in your family, is anybody has this problem, or how you got this disease? Do you have any idea?
I don't know anything, nurse. I don't know what you're telling all these things. I don't know anything. Nobody has this one. But can you explain me more detail regarding this one? Am I likely? I understand a little bit of what you said that I have some cancer, something skin cancer. But okay, I can understand. But
Yeah, I will. Yes, I can explain you the details for the skin cancer. What it is. Actually, this is a very normal thing, and people they are getting this with the normal routine, and normally they cannot judge their skins while having a sun exposure and with the ultraviolet radiations. They more. It depends on your routine and how on your atmosphere and whether where are you living and whatever your routines is that. So most of the things people they are getting through that, and it's spread on your body, and sometimes there is some lesions or there is any scar on your skin, and we never judge that whatever the skin condition is, and for that reason you have to need the consultation, and you are here, and nice to see you here, and doctor will explain you further about your surgery and everything, whatever the required treatment for you.
That's
Is that
really
clear, Mr.
very
Lincoln?
fine, nurse. But I want to ask you, am I likely to need more surgery to remove other lesions in the future?
For that one, where doctor will explain you all the procedure, like how you can observe your skin and how you can rule out that if there is any other new lesion or scar on your skin. So how you have to come in the clinic and you have to do the proper examine for that. Sometimes people they are getting this kind of things like temporary. There is no required for surgery, but sometimes there is some serious issues, so they require the surgical operation or removal of those a part of the skin, and it is very normal. Don't you worry about it, and we will explain you everything in the details. And for the post surgery precautions are that if you feel like that any pain or any discharge in that care condition, immediately you have to rush to the hospital, because in that cases you have to need the consultation with the doctor. Is that clear?
That's right, nurse. Okay, fine. Actually, the thing is there anything that precaution that I can take?
Yes. The precautionary measures are this. Like whenever you're going out and you are exposing yourself directly to the sunlight or any ultraviolet rays, you have to wear the covered dress and also protect the sunscreen, your skin with the sunscreens, and these are the normal and very minor protections. And just if it is possible for you, you can avoid your skin to getting the sun exposure, and let's go out in the daytimes. I think so
Okay.
these are very normal and things which you can easily understand and implement.
Okay, nurse. I really understand everything. But yeah, earlier, I can tell you one thing. I have been using this high factor sunscreen recently, and then that is 30 or higher number, and I wear a hat when I'm going out in the sun, but I think it's too late. Damage has already happened, and I spent too much time in the sun in my teenage years. Okay, so when I was in my youth, I did not bother about all these things, so maybe because of that I'm suffering now. So I don't know. Definitely I'll take care in the future.
No. Yes, Mr. Lincoln, I understand your point. But the time which is already gone, why we have to think about that time? The most important thing is that we can focus on the future things, like how you can protect yourself in the future to getting more this kind of skin problems. Okay, do you understand my point? And it's a very easy thing. Like just you have to take little precautions, and in those precautions you can I hope, and I will. I can explain you everything in the details, like how you can protect your skin from this, and as the part of the sunscreen, Like let's suppose if you are using SPF 25, 30, 50, max people they are using 50, and there is a time period of that SPF, like when you have to repeat that SPF. If you have like whole day in the sun exposure, then after 2 hours, 1 hour, when you feel like that your skin is out from the SPF, then you have to repeat that SPF protection on your skin. Do you understand my point? Because
Yes,
while
yes.
busy in the thing, we forget that our skin is getting damaged with the sun exposure.
Yes, yes, of course, nurse, definitely. I will follow that one. I'll definitely follow your suggestions. And then, yeah, okay. I
But
look
still,
after my skin. I look after my skin from now on. Yes, nurse.
but still, if there is any query, still you need further clarification. You can present anytime in the hospital or contact with the doctor, so they can provide you. There is some reading brochures, some precautions, and you can get all details from the internet and from the YouTube. Everything is available very easy. Just you have to be little bit in your mind, like precautionary basis, how you can protect your skin.
Yeah, that's absolutely fine, nurse. But yeah, I listen to you, whatever you say. But I want to tell you that the wound has been fine. There's no pain or discharge, but I still think it's too early to have the stitches out. What do you think, nurse?
No, normally the timing of the removal of the stitches within a 7 to 14 days. But before removing your stitches, doctor will observe your wound, if either your wound is in the healing process or not. And hopefully it will be in the healing process, and a doctor will rule out the condition of your wound. And after that, they will decide that either they are going to remove by today, or it will take more time to heal your wound. Okay, so don't you worry about that. They will explain you prior everything before doing any procedure with your skin or with your wound, whatever it is.
Right, nurse. Thank you very
understand?
much. Thank you very much for the valuable information provided. And I tell you, I'm okay with that, and I'm ready to implement all your suggestions with all my body, mind, and heart. Okay, fine. Now I'm
Okay,
ready.
thank you so much, Mr. Lincoln.
Removed, and I give my consent for that. Thank you very much, nurse.
Most welcome, Mr. Lincoln. Most welcome.
Yes. Okay. Fine. Yeah, Barkat, you were asking me yesterday regarding whether I have to postpone because I don't have any time or anything. Don't need to go to postponing. Okay. With regard to speaking, you are very fine. Ask when you are with regarding speaking, you are perfectly fine. And if you do like this, definitely you can score above 400.
Okay, sir. Thank you so much for your positive response.
Your today's score is 400 minimum and maximum 420. Okay.
Okay, sir.
Today's course. If
Thank
you
you,
follow
sir.
the same thing, one second. Neha. Yeah, I have been trying to you, and I asked Ashwini also to follow you. Be ready. Come jump into the session right away. Okay. Yeah. So, what's the Rakil, right? Rakil. Yeah, Rakil, you're very confident. Your pronunciation is excellent. Your fluency is just drifting like mercury on the floor without any stop, non-stop. Wonderful, amazing, and the vocabulary is also fine. Subject knowledge is excellent. Everything is fine, but you have a big drawback. Shall I tell you?
Yes, of course, sir. That I need to know.
I don't want any background. I don't want any background disturbance, because of course I can understand your situation, whatever it is, but because of that you are distracted. Otherwise it would have gone to 440 or 450.
Okay, sir. Sir, actually the thing is that this is a morning time, so usually my kids are awake. They're up
No.
this time.
I'm not asking any explanation. I know. I'm not asking any explanation. I'm telling you, try to prevent such things, because they will be it is good for you. I'm only telling you. Okay, I'm only telling you, because your son is crying means automatically your mind will be distracted. No mother can take it easy, correct?
Yes, sir. Yes.
Emotional, and that emotional will be coming in between this learning. Okay, and you cannot do 100%. You did not do 100% for those I can say one question or 1.5 question. You could not do justice. Okay. I'm telling you frankly. that really impacted your score. I'm telling you, I have cut down almost 40 to 50 marks just for that incidents. Okay.
Okay,
Just,
sir. Okay, I understand.
okay. You lost 40 to 50 marks. Okay. So next one. Now let me give you feedback. Everything is fine with you. There is no problem. You can dash for the speaking exam. Others I will discuss afterwards when the time comes. You understand?
Okay, sir.
Now,
Thank you, sir. Thank you, sir. Okay.
I'm telling. When writing, I'll tell about writing. When listening, reading, I'll tell you. So control that one.
Okay,
Now I
sir.
don't have much to tell you about, but yeah, let me ask you. Now I'm straight away going to the, before giving, let me give one sentence for you also. Right. You say like this, for example, what is it? You have to reassure patient, that is reassurance over, removal stitches also over, need for ongoing prevention that you have to give. Yeah. Now I'm giving you the third, fourth question, stress need for ongoing prevention. Yeah, now you tell, what can I do for preventing this one? How can you ask me? You're a patient, now we are swapping the roles.
Sir, for the prevention.
Yeah.
Sir, I need to ask you, like, what as a
You're a
nurse,
patient now. You're a patient now. What should
okay,
I
okay,
do
sir.
for
So, nurse, can you please tell me how I can prevent myself from the further lesions?
Yes, one second. Hello, Nofa. Yeah, I have been trying from morning. Okay, I asked Ashwini also follow up. Okay, come on to the jump onto the group. Okay, I'm taking speaking sessions for the doctors. Okay, come fast. Okay, so next, what is that name? Neha Bano, be ready. Yeah, sorry for the interruption. Yeah, Rakil, can you ask the question again?
Yes, nurse, can you please explain me a little bit about that, how I can protect myself in the further lesion or further skin abnormalities?
Yes, Rakil, there are two dimensions for this problem. One is past orientation and one is future orientation. For future safety, what should we do now? Now there is nothing called prevention. We cannot do anything because past is already past. We cannot do anything.
Okay.
Therefore, just stay silent now. Don't say anything. Just stay silent. I am speaking. Don't interrupt. Finish it. Your role is finished. Now I am telling you. Right. So, for what happened in the past, there is no brooding over spilt milk. Now, what we can do to prevent for the future implications is important, not to get more difficulty. Minimize the problem, reduction, protection we can do. So what we are supposed to do now? There is an urgent need, a requirement or a demand for ongoing prevention. First and foremost, you have to cover your face and skin, which is directly exposed to atmosphere and the sun. If you are wearing clothes, that is okay. But whichever area like face, neck, hands, and feet, whichever is exposed largely to the sun, that area you have to take care of. Every time, whenever you go, day in and day out, whenever you are in the house, before going, take all the necessary actions like applying sunscreen. And when you are going out in the sun, avoid the severe scorching sun rays as much as possible, using a hat or an umbrella or something else. Prevention is better than cure. After allowing the problem to grow, treating it later rather than this situation, it's always better to prevent. Prevention is better than cure, as the saying goes. So for that reason, okay, for further damage, avoid these conditions. And then tell me about your skin, wound condition. Is there any pain? Is there any discharge? Is there any pain? Is there any discharge? Or are you facing any trouble regarding this pus like anything? Now you understand what I'm doing?
Yes, sir. And yes, sir, I understand that. And one more thing, sir, prevention is better than cure. That is, if I'm not wrong, that is a idiom, right?
Which one? Rather than, yeah.
Okay, sir. So that is a very good thing. That point I can use in any kind of like whatever the topic will be.
Yes, yes. You can
Okay,
just,
sir. Sir, thank
you
you
have
so much.
given a good point. Let me show that one. What is that? Rather than you use, right? You asked me, right?
Yes.
So rather than, okay, sorry. Why I'm coming here? Rather than, yeah. I'll show you the Cambridge Dictionary rather than I myself explain. Rather than. Now, what is this rather than? Rather than is an adverb. Rather is an adverb. Rather than. Rather than. Yeah, rather than is an adverb. Preference. Rather than is an adverb which means preference. Instead of. You can also use instead of. Used especially when you prefer one thing or other. I think I'd like to stay at home this evening rather than go out. I think you'd like to take prevention rather than cure after getting the disease. You understand now?
Okay. Yes,
So you
sir.
can
Yes,
use
sir.
that. Anywhere you can use that one, okay?
Okay, sir. Thank you, sir. Thank you so much for your suggestion.
Yes, yes. Now I want to ask you one thing. You have 30 seconds now. You have 30 seconds. In this 30 seconds, you share your experience regarding the sessions, the classes which you have taken regarding this speaking session. This speaking section in particular and normal speaking sessions in general. Tell what is your feedback regarding the session? How did you improve, or are you gaining confidence? Are you getting the quality you expected? You joined for a short course. You paid 7,500 just for short time or whatever it is. So why? Tell me.
Sir, it's a very beneficial for me because you give me that confidence and courage that like how I can I have a command on the topic. Like before I can speak, but I don't have experience how to speak on the specific topic. I can speak on the general topic, but the topic is related to medical. That is a specific thing, and you have to keep in the mind like how to have a conversation with especially with the patient as a nurse. So that command I can get only I got only with the practice sessions with you and that girl Pizza as well. So now I'm confident, and you give me the feedback as well. Like I can present this role there easily. So thank you so much for your courage and for your help and for your suggestions. And you build my trust on myself. Like I can prove myself that I can be clear in this. Hopefully, I can be clear in this part of OET.
Yes, your speaking is cleared. Okay. Take it for granted. Your speaking is cleared. Unless and until you do some major drawback, your speaking is cleared. Okay.
Okay, sir. Thank you so much for your positive feedback.
Yes.
Okay,
Yes.
sir.
Yes. You can mute
Okay,
back.
sir. Thank you so much.
You can mute back. Next is who is that next? Shifali, you said I will be next, but already I gave a promise to somebody, come fast, because you said, okay, wait, just wait, because I already called 2 people. One is Neha Banu, and then where is this Dr. Nofa? Dr. Nofa did not come. Okay, fine. Neha Banu. Yes, Neha Banu.
Hello, sir. Good afternoon.
Yeah, Neha Banu, follow up in the group. Okay, fatafat, you come finish and then you go. Okay, right?
Okay, sir. Yes, sir.
Today did you submit your timetable?
No, sir, not yet.
No, you submit once immediately speaking. Just submit the timetable there. Okay. Right?
Yes, sir. Yes, sir.
Nofa is here. Pinku. How do you know Pinku is the Nofa? Whenever you join, write Nofa. Hamid. Okay. Okay, fine. I did not see you. Otherwise, I would have finished you first. Okay, because more than you. Okay. So right, Neha.
Yes, sir.
Yeah. Because Neha already did one test session. She got speaking already done. Okay, cleared. So Neha, is a newcomer. She's going for the exam first time, so she needs more support than Nofa. Okay, fine. Yeah, anyhow, Neha, are you ready?
Yes, sir.
Nofa Hamid, be ready. Very good. Okay, very good. You already wrote Nofa Hamid, very good. But write N capital letter and H capital letter. Okay, all your names you have to write like that only. Capital first letter should be capital letter. Learn. You are coming to Simon sir, and you don't know how to write your name. It's the same for Simon sir, not for you. All of you, all of you. Okay. Yeah. Nofa, where is Nofa? What happened? Again, network problem or? Yeah. Yes. Right. Ready. Yeah, Neha, prepare.
Yes, sir.
Neha, prepare. 3 minutes. Because you just came now, I'm giving you time. 3 minutes.
Okay, sir. Okay.
Ashwini, send the card to Nofa. Speaking card, it is there in the medical group. Christmas. Group doctors, Christmas A. Nofa, you are already there. Prepare that card. Yes. Neha Banu. Neha Banu. I'm unmuting. Nofa,
Yes,
get
sir.
ready. Prepare and be ready, okay? So that we can start directly. Nofa Hamid, prepare and be ready. Yeah, Neha, are you ready?
Yes, sir.
Okay. Right. In the evening also,
Second,
I'll take one session for you. For those who are Ashwini, find out those students and give me the list, and evening tell them fix one time, 1 hour, and finish up all the speaking, second round speaking for these students. Please, Ashwini, make it, follow it up, because these people, I'm not able to chase them. Okay, follow it up. Follow it up. All the students who are there, tell them, fix their time. So and so time, they'll finish an order. Give me the order also. Yeah. Ready now, Neha. Yeah. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Today we are taking speaking sessions for the medical professionals, and the first one mainly doctors and the second one nurses. Now we have here with us Neha Banu, a nurse from Hyderabad, and she's preparing for the nursing specific POET. She's going to do the exam this Saturday, 5 days from now, 5th day from now. Yes, Neha, go ahead.
Good afternoon. My name is Neha. I'm one of the registered nurses working in this facility. For the confirmation of my documentation, can you please tell me your name?
Yes, nurse. My name is Lincoln, Abraham Lincoln, and you can call me Lincoln.
All right. And how old are you?
I am 51 years old.
Okay, all right, Mr. Lincoln, thank you for telling me. And I have your case notes. I can see that recently you had lesion removed, removal surgery from your hand and followed by squamous cell carcinoma. Am I right?
You're absolutely right, nurse. That's what I came here for. But yeah, the doctor also told the same thing, and you're also telling the same thing, that something squamous carcinoma. I don't understand what it is. Is it something dangerous like a cancer or some other coronavirus, or what exactly it is? I want to know the picture in detail, because it is my life and I cannot risk it. Please give me complete picture about it.
I can certainly understand from your side, Lincoln. First of foremost thing, I would like to tell you that try not to overwhelm yourself. I will explain you in detail what is squamous cell carcinoma, what are all the preventive measures of this condition. Don't worry, I will tell you. By the way, first, the purpose of mine to come here is I just came here to removal of your stitches and to assess your wound and to redress this dressing. So for this purpose, I came here. Now I will explain you what is this squamous cell carcinoma. As you heard from the doctor, that is right, your diagnosis is this. So it's a type of cancer. So mostly it's caused by the sun exposure with ultraviolet radiation. So this is the major cause of happening this squamous cell carcinoma. And but don't worry, as you have already undergone the skin lesion removal surgery, it is a very effective surgery. Don't worry, it will not spread. It is unlikely to spread, but I would highly recommend you to check your spots. You need to close monitor your skin, whether the spots are changing or growing new cells. All these things you need to check. And also, besides all these things, a very important thing is you need to talk with the doctor whether one more surgery is required or what are all the preventive measures. Are you able to follow me, Lincoln?
Yes, of course, nurse.
All right. As I told
and
you,
I now have a better understanding of what squamous cell carcinoma is now. And I want to ask you, nurse, if I'm likely to need more surgery to remove other lesions in the future. Yes, that is what you have told. I want it to be confirmed. What, nurse, what do you say?
Okay, all right. I can certainly understand. I can see that you are a bit worried, and it may become as a very emotionally draining thing for you to know about this thing. But as I told you, don't worry. Already you had one surgery, and it is unlikely to spread. But you need to talk with the doctor whether one more surgery is required or not. But don't worry. Besides all these things, I would like to know what are all your habits regarding, as I told you, this cancer mostly happen just because of the sun exposure with ultraviolet radiation. So I would like to know that what is your habits when you go out?
Okay, That's fine, nurse. Actually, the thing is, I always wear a high factor sunscreen, 30 or higher, and I wear a hat when I'm out in the sun. But I think the damage has already been done, and it's just repenting. It doesn't make any sense. Doesn't make any sense. So it's late already, and I have spent almost all my teenage years in the sun, and I damaged my skin. I know that. I agree. But instead of brooding over spilt milk, let me take some preventative measures. Why don't you tell me something what I have to do in the future to protect myself and reduce the intensity of the problem or minimize the cancer?
Okay, Lincoln, I can certainly understand that you're worried that your progress is slow, but I can understand you're coping well, and I really appreciate that you have been doing so much. But don't worry, as now you have been diagnosed already, your condition within it is manageable for right now. So for further prevention of the damage or further damage of this or spread of the cancer, I would like to highly suggest you to apply whenever you go out. You have to apply a sunscreen which will be advised by the doctor, and you can also wear some hat, and also like other measures like you can wear full sleeves or regarding clothing. So all these measures and also more measures I'll provide you with through the leaflet or a brochure. So if you follow all these measures, it will be very helpful for you for the further not to spread this cancer. All right, is it okay to you, Lincoln?
Yeah, thank you very much, nurse. That's really
Okay,
fine.
all right.
I'll definitely look after my skin from now on. But I want to know, I want to tell you that my wound has healed. Yeah, definitely it's fine, and there's neither pain nor discharge. But I still think it's too early to have the stitches out. What do you think, nurse?
Okay, before answering of your question, I would like to ask you that when you had this lesion remove surgery, so have you experienced any pain, or is there any discharge at the site of that injury?
No, nurse, that is quite obvious. Nothing is there, and I don't face any problem. But why should I let it wait for some more time now, 1 more week or something? What do you say?
Okay. All right. I am happy to hear that there were no pain and no discharge. It's healing well. It is a sign of healing well, progressed well. For right now, actually, when you have surgery. So regarding the dressing, mostly it will take 7 to 14 days to remove the sutures and for all the dressing. But for right now, doctors has advised for the close observation to assess of your wound. So whether it's healing or not, just to check for that, you have been advised to come here to check the healing, redressing, and if healing well, so doctor will advise for the removal of the stitches. So for that reason, you have been advised here. Are you able to follow me?
Yeah, definitely. I'm able to
Okay.
understand. Everything is quite clear. So I understand the importance of removing the stitches, because there is no meaning in keeping, because it's already healed, you say. So you know better,
Okay.
and I can definitely follow your suit. So I'm ready, and I give my consent for the stitches removal.
Okay, all right, Lincoln. I think I have cleared all of your doubts. So at last, I would like to tell you that always keep your wound clean, covered, and dry. This is the very most important thing which you have to maintain. And also, besides this, after the dressing, I will provide you a leaflet which will contain all the preventive measures what I just explained you. And also, besides, there's also other measures. It will be also mentioned in that. Thank you.
Thank you very much. Have a nice day. Yes. So coming to the point, here we are. So next one, no, for Hamid, be ready. Okay. Yeah. Neha. Neha, what are all this you are repeating this? It's a commonality for you. You have said 2 or 3 times this one, and not exactly, but definitely 2 times you have told. Third time, I'm not sure. Okay, then you're telling. That sounds, unnecessary sounds, and pauses and breaks are there. And you're saying, don't worry, don't worry, don't worry. Why are you saying so many times, don't worry? These are your flaws. What is your habits? What is your habits is wrong. What are your habits? or if it is a normal sentence, what your habits are. Okay, let me know what your habits are, or tell me what your habits are. If you are asking a question, then you have to say, what are your habits? What are your habits isolated? But if you want, please tell me what your habits are, like that you have to say. So that is the way how you have to say. So there's some mistake there. You have to rectify that one. These are the things. But definitely you have cleared today's exam. If today is your OET, you have cleared this OET exam. Unless and until you do some dramatic problem, mistake, something confusion you get and made some problem. Otherwise, you have cleared this test. It's 350 more than 300. It is 380, I can say, maximum, and 360 minimum. That's what your score for today's test is. It's not more than that, but you have to work a little harder, and then you have your confidence, subject level confidence is very good, but avoid these mistakes which I have told you, and the commonality factor and repetitions, avoid them. If you avoid commonality, that means what are the like that, same thing repeating, don't worry, repetition, you will get 10 more marks. And apart from that, instead of this one, if you can explain, okay, instead of saying don't worry, explain why he should not worry. There is nothing to worry, because this is a common condition which many people in the world are facing, and you are not the odd man out, but one among the many. So if many people can follow and get improvement, can manage their life condition, so why not you? Definitely you can overcome this problem, and you can lead your life as usual as anybody else, unless and then, okay, by yeah, if you are compliant with medication, exercise and dietary regimen, or whatever it is, if you follow implement the suggestions of the medical professionals or the doctor, and definitely you can overcome the situation and minimize the problem and lead a normal life as any other individual. Only the thing is, you have to take preventive measures and not ignore the intensity of the problem. Is that clear, Neha? Yeah, Neha, is that clear?
Yes, sir. Hello, sir. Yes, sir.
So did you get the clear picture of what I'm saying?
Yes, sir. I got the repetition of that words.
Yeah. Now I'm giving you the mic. You have 30 seconds. Okay. And in these 30 seconds, you have to explain what is the what do you feel regarding this session and how you are improving. And yeah, you are free in speaking now. You're totally free in speaking. You can relax and practice. And in the evening, you can go for another, because you're going for the exam this Saturday. Ashwini, make a note of people who are going for the exam, the second session for them, priority basis. Others, you'll have only one session. Yeah. Yeah, Neha, your time starts now, 30 seconds.
Yes, sir. Last few days, the Ashwini ma'am and other ma'am also were helping. I was doing daily 2 speaking sessions with them. So it was really helpful for me. Right now, I got a chance to speak so in front of you, so that now I became confident. Like just now when you told that, okay, I can get if my exam will be there today. So I'm now very much confident. Okay, I can do the speaking session. Thank you, sir, for just conducting this session and making me confident.
Yeah, you know, I will never tell something which is not. What is the fact? I'll tell you. It's right means it's right. It's not means not. That's all. I don't mind anybody. You know that, right? So you
Yes,
can
sir.
directly go to the exam and dance the show. No problem. But
And
don't make
thank you,
any
sir,
major
for
problem.
taking out my mistakes. Actually, whenever you take out the mistakes, I just give very much superiority to that, how to improve that. Always in every session, I used to do that thing. But for in the speaking, this is the second thing, second one I'm doing on live with you. So I'm really happy now. I can confident. Okay, I can do my speaking session. I'm tension free, I can say.
Yeah, so you can go and submit your timetable and finish one reading and one listening and one writing and send them to me. And I'll call you in the evening for another speaking session, and I'll correct your letter live. Okay?
Okay, sir. Thank you, sir.
Fine. Okay, that's next is Nofa, Dr. Nofa. Nofa Hamid. Hello, Dr. Nofa.
Hello, sir. Good afternoon, sir.
Good afternoon, sir. How are you? You're like a small child. I don't know. I feel like I'm talking to a small child, little girl, my little girl. Okay, right. Now speaking medicine, this is your card and this is your card. View full screen mode. Yes, get ready. You already prepared, I know. So just to go through this. Yeah, this is your card. And this is everything here. And I'm closing the screen. You already prepared. Are you prepared or not?
Sir, I prepared somewhat, sir. We can start.
Yeah. Okay. Shall we start now? Okay. Ready. 1 second. Nofa Hamid. You already passed the exam. Okay. I'm targeting you for 450 now. Okay. Right. Yes. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting speaking sessions for the medical professionals who are preparing for the OET. And we have doctors and nurses who are our regular students, and we are conducting sessions on a regular basis. And today now we have with us Dr. Nofa Hamid from Tamil Nadu. Am I right, Nofa?
Yes, sir, you're right.
Yeah. Right. Nofa. Your time starts now. You can start the show.
Good afternoon. I am working Dr. Nofa. So I've seen you for the before 4 days with the complaints of pain in your chest. Am I right?
Yes, doctor, you're absolutely right. I'm really very upset. I don't know what to do. I'm confused, agitated, and everything. I can tell you I have felt much weaker and very tired since the heart attack, and I'm worried that any physical activity such as walking, gardening, or swimming might eventually bring on another heart attack, which I do not want. I want to prevent. So what am I supposed to do? How much physical activity do I need? Please, doctor, please help me. I don't want to face a confusion.
I am so sorry to hear this, that this situation can get very or can come to normal within a few weeks. It takes completely a few weeks to get back. Don't worry about that. Uh, what level of fatigue you have right now? Can I know about that, please?
I'd like to know, doctor, not fatigue. I'm in a mental, mentally I'm not able to take decision. I don't know what is the, how much action, what type of actions I should do and how much exercise I should do. I don't understand what type of exercise to do. For example, if it is walking, how much time I should walk? Should I walk for 5 minutes or 10 minutes or 15 minutes? What I don't understand anything. So please explain me what is good for me.
Before saying the how much exercise the one patient has to undergo after the patient suffered from a myocardial infection, that is in your own word can say in the chest pain, in the few patients has joined the cardiac rehabilitation program, and with that the patient's outcome have a good result. Can I suggest that one for you if you don't mind?
Yeah, definitely, doctor. Definitely, that would be wonderful. Thank you for your concern. And tell me what, don't hesitate to tell me anything for my health. It's for me only you are suggesting, because, I want to tell you, doctor, I am 45 years old and my children are in their teenage, 13, 14, 15. In the teens, and the eldest one is just 17. I want to see them successful in life and get them well settled. I don't want to risk myself. For my children, I am the only breadwinner. What will happen to my family if something goes wrong? So please, considering all these things, from the best of your knowledge, suggest me anything possible. I'm ready to do that.
I completely understand the thing what you're saying, because if I am in your situation, I also think the same thing. And I have to explain some of the importance of exercise. If can I do that? That example, taking the lower cholesterol, example, not eating fatty diets, and and maintain the weight and strengthen the heart. These are the things to be kept in the mind. to follow the exercise. Are you clear with this, what I'm saying right now?
Yeah, doctor, I'm very much clear now. It's perfectly fine to explain all the things, but I'd like to know, yeah, I am an office worker. And all day long, from morning 9 to evening 6, I'm just sitting in the chair and doing nothing, no exercise physically. I'm just doing some file work, signatures and passing on and nothing else. And I don't have even a moment to go here and there to just have my coffee also. I'm so much trained and I'm helpless. So this, keeping all these conditions, suggest me.
As a working man, you have this anxiety, and this is very common with all the patient I'm usually facing with. They always used to say this, and I can, as a doctor, I always suggest you the good things. It always takes 4 to 6 weeks to return to your back to normal. Before that, you can perform some of the moderate physical activities. So from my 10-year experience, I have seen the patient usually with who is working experience this type of chest pain. I always recommend them to take rest and to return to the work after 4 to 6 weeks. And they also about always worry that they have a children, they have to work, and their lives, and the family, they are the head of the families. They always worry about that. I would recommend 4 to 6 weeks before attempting to return to work. So is that okay for you?
Yeah, of course, that's fine, doctor. But yeah, I'm worried about having another heart attack. So I'd like to know what I can do to reduce the risk of further attacks.
You can modify your diet. Don't first be anxious. Always everything will come back to normal within a week, and it will gradually will become back to a normal life within 4 to 6 weeks. So just take a regular diet, relax, and just manage your stress. That's the thing I always recommend and advise a patient who have recovered from a chest pain. I hope you understand what I am saying.
Yes, of course, nurse. That's really fine. I appreciate your guidance, suggestions, and everything. And then, what more is, yeah, I want to tell you that the information has been extremely beneficial. I'll try to gradually do more exercise, and I'll look into the program for rehabilitation. If you can suggest anything.
Yeah. Do you have any other doubt to consult with me?
No, doctor. Thank you very much. It was so nice
Hope
of you.
Hope you will get a good recovery very soon. Thank you so much.
Thank you, doctor. Thank you very much. Okay. Right. Dr. Nofa, here I am with you now. I'm going to give you some feedback for your improvement. I think all the practice which you have done the last 12 or 15 days in your previous crash course, that definitely you still remember, and you're using everything in with all my experience of 15 years. You are using the phrase like that one. I really appreciate that. In my experience of 8 years, I have seen many patients, and they have recovered from the condition. So this is what you're putting into the shoes of the person, and you're explaining everything very clearly. So that's really wonderful, and you have not forgotten your previous practice and the suggestions given to you. Definitely you're going a long way. But the thing is, the tone you are doing, as if you are trying to please somebody. The way how you're talking is like in Arabic, they say miskeen. Miskeen means helpless person. Helpless person. Your voice is like a helpless person, not like a powerful person. See, like how I'm talking is a powerful person. And if you do like this one, if you work hard, and then if you, as if you want to please request, like you're talking to a small child. Baby, don't cry. I am there. No. Like then you are feeling sad for that person, but too much sad you are feeling. That's the point. You have to talk with a little command and love and affection and everything mixed together. But the way how you're talking is like you're talking to a child, and as if you are a child yourself, and you're requesting them to do your way like that one. No. Little more command, and you'll definitely get 50 points more.
Okay, sir.
Powerful. Okay. Everything for Yes, sir, like that. Okay, that is the command you need. Command you need. Okay, it's not like that of pleasing, but don't bow down to ground to be as if pleading somebody like that. Convincing way you have to. Yes, whenever there is a problem, you can approach me without any hesitation. I'm giving you the notes, sir. Write down. For you, I'm giving you a sentence. What should I do, doctor? What should I do, doctor? What about the further attacks? I absolutely agree with your concerns. Your concerns are the concerns presented by you are absolutely reasonable. Therefore, my suggestions for this is, in case you feel nervous or worried, or if you need any clarifications, never hesitate to contact me anytime. I am there to support you in every way possible. First and foremost, your health is our fundamental prerogative or priority. For that, we are ready to anything possible. Any case, any situation, anytime you need any doubts to be clarified, never hesitate. Just ring me up. If not available, message me, and we'll get back to you at the earliest. Some more quality sentences. Professional exposure will not provide you sufficient timing for exercises because you're working beyond reason. So definitely, but you cannot take it as an excuse and ignore your exercises under any circumstances, because your life you cannot risk, because you have to live for yourself and for your family, and therefore health is a fund of utmost importance, and only you can take necessary measures. If you have a stomach pain, you have to take the medicine. If you don't have time for exercise, you have to take some, you have to separate some time, and in that time particularly, okay, alternative measures you have to take so that you can practice on a regular basis. Of course, you don't have time for regular exercise in the office because you are at a desk working daily, but what you can do is, whenever in the morning before going to work, when you get up, or in the evening when you're relaxed, just to take a stroll for 15 minutes in the morning and 15 minutes in the evening, and never refrain from doing so. Make it a regular habit. In spite of inviting further complications, better take preventative. In spite of inviting further complications to ruin your health further, better prevention. Prevent now, rather suffer later. You have loads of wisdom. Apply that common sense and try to do everything possible. No one wants to suffer. So do you. So what is the best interest of your health? Plan carefully and implement wisely, and never, ever refrain from participating in any activities that will result you in positive consequences. Did you get my points, Dr. Nofa Hamid?
Yes, sir, I got the points.
Maybe my voice or tone will be harsh, but you can see the love within, right?
Yes, sir, sure.
Okay, now I'm giving you 30 seconds. It is your time, all yours. Speak out what you learned today. How was the session useful? How was my treatment to you? What are my feedback? How it benefited you? Are they really useful? Are you scared or it gave you more confidence? Everything, 30 seconds only.
Always your lecture is always very very much with love, and I always used to listen your lectures. Whatever the mistake you are correcting for us, it's for us benefits. I've already given one time OET attempt, but I failed in listening and reading, but because of you I passed in writing and speaking. Again I'm going to give my exam, so I thought of improving the more marks in both speaking and writing, as well as I have to try to pass in that of listening and reading. With your help, with your help and with your whatever the thing I'm doing as a mistake, with your corrections, I just wanted to clear them in the next attempt, sir. I hope to do so. That's why I've joined again in your class, because I've kept faith in you, and again I'm having confidence in myself, that so that I can achieve in further exam, because this is my entry exam of my further medicines in practicing in UK. My dream job is my medicine, but before I have to clear this, that's why I've chosen your grandmaster session to be joined and to clear for the exam, sir. Thank you so much.
Thank you very much for the feedback. Simon sir is famished. He is running for dinner. And sorry, I cannot think of anything else. Anyone needs a speaking sessions, contact Ashwini, fix up your time, and afterwards we can see. And in the afternoon and evening, we are correcting the letters. Okay. Speaking is a priority. Speaking I will take afterwards only. I will do writing corrections, and I'm going to do writing corrections in the evening today. So please excuse me. I'm out of your sight. Thank you. Have a nice day. Wonderful. Thank you once again. And those who have not submitted their timetables, please submit them without fail. Otherwise, I will not encourage you tomorrow under any circumstances. Have a nice day.